All right, I think it's time to start. Welcome you all. Sorry, I have to. Sorry about it. I have to mute my phone. All right, so we are starting another fantastic lecture. My name is Anand Mahinkanda from Samahita Nature Foundation, USA. And for this event, I am joined by two other organizations in Sri Lanka, Society for Health Research and Innovations, headed by Dr. Anuruddha Padiniya and Dr. Vasan Ratnasingham, and also the Presidential Task Force for Local Food Promotion Campaign, headed by Dr. Batagoda and Dr. Kumudu Dahanayaka. And also we have a panel of doctors, Dr. Harris Patirage, Dr. Sujiva Vikramasinghe, and Dr. Rohan De Silva. So we all joined together to for one particular purpose, just to create the awareness, especially among Sri Lankan community, as to how a plant-based diet can cure non-communicable diseases. That is one reason. And the other thing is actually to promote environment and animal ahimsa and all these things. So we are a nature-loving group of people, and especially we know that Sri Lanka is a sick nation, and I'm sure even most of the other parts of the world as well. Every family has at least one person suffering from a non-communicable disease, either heart disease or cancer, diabetes, liver disease, or kidney issues, something like that. So all these things, what we now say here in the USA is that all these diseases can be preventable, and even when you have these diseases, this can be reversed. So just a little bit of housekeeping. So we keep all the participants muted. If you have any questions, you can put in the chat box. And at the end of this session, Dr. Neal, once it is over, we are speaking in Sinhala with the other panel of the doctors. If you have any questions, you can ask in Sinhala as well. And just a few words in Sinhala. Mitrorani, this may සාකච්ඡාව කරන්න විශේෂයෙන්ම අපේ ලංකාවේ ජනතාව වෙනුවෙන් සහ වෛද්‍ය ප්‍රජාව වෙනුවෙන් හේතුව අපි දන්නවා අපේ ලංකාවේ බොහෝ දෙනෙක් මේ බෝ නොවන රෝග වලින් පෙළෙනවා. ලංකාවේ මරණ වලින් 85%ක් බෝ නොවන රෝග නිසා සිදුවෙන දේවල්. අපේ ලංකාවේ ජනතාවගෙන් 25%ක් විතර දියවැඩියාවෙන් පෙළෙනවා. ඉතින් මේවට ඉතාමත්ම ලෙහෙසි පහසු සුදුසු ප්‍රතිකර්ම තියෙනවා ශාකමය ආහාරයකට යොමු වෙන පමණක්ම. ඉතින් ඒක සරලයි, ඒකට මේ පරිසර හිතකාමී, ඒක අවිහිංසාවාදී ආහාරයක්. ඉතින් දැන් ඇමරිකාව වගේ රටවල මේක ලොකුවට ප්‍රචාරය වෙනවා. නමුත් ලංකාවේ සිද්ධිය සිද්ධ වෙන්නේ නැති නිසා තමයි අපි මේ කාර්යය පටන් ගත්තේ. ලෝකින්න උතුම්ම වෛද්‍යවරුන් ලවා රිසර්චර්ස්ලා සයන්ටිස්ට්ලා හරහා මේ දැනුවත් කිරීම ලංකාවේ සිද්ධ කරන්නට. හොඳයි. So I will now introduce our guest speaker, Dr. Neal Barnard. It's a great pleasure, Doctor, to introduce you and welcome you. Dr. Neal Barnard is a renowned physician, clinical researcher, and best-selling author who has dedicated his entire career to promote health and wellness of our fellow human beings. Dr. Barnard is a professor at the George Washington University School of Medicine and has authored numerous books, I think more than 30 books, Dr. Right? Including the bestsellers like Dr. Neal Barnard's program for reversing diabetes and the nutrition guide for clinicians. Now this book, the nutrition guide for clinicians, actually is being used by all over the world, even in Sri Lanka, the Postgraduate Institute of Medicine for Clinical Nutrition, and they also use this book as a handbook. Dr. Barnard is the founder and president of the Physicians Committee for Responsible Medicine, PCRM, a very powerful body that takes things very seriously when it comes to wrong nutrition guidance. In fact, Dr. Neal Barnard has fought with organizations like USDA and FDA, and when they give some wrong guidelines, and he's calling them, and sometimes he takes them to courts, and I think, and win those cases. He's such a powerful character, even though he's very smiling and very kind. Yes, he thinks things very seriously. He's a lead researcher at NIH. NIH is the National Institute of Health, the biggest medical research institute in the world, and he has been at the forefront of groundbreaking research on the role of nutrition in preventing and reversing NCDs, non-communicable diseases, and various other health conditions, including diabetes. He has featured in many world-famous documentaries and movies, such as Forks Over Knives, What the Health, Eating You Alive, The Game Changers, Cowspiracy, Hope, and many, many more. So I would encourage you to actually just go to YouTube and type Dr. Neal Barnard, and you will see hundreds of YouTubes and videos. And at least I request you to watch one or two after this session, not now. So he has many talents. I'm not able to actually explain everything. The best thing is to Google. So go Google and just type Dr. Neal Barnard. Anyway, more than anything else, he's a very, very kind, compassionate, caring personality. And he's such a wonderful human being, because I became a vegan actually after listening to one of his lectures. So thank you, doctor, and welcome you again. And I hand over the audience to you. Thank you.
Thank you very much for that very, very kind introduction. And thank you for gathering so many folks together to talk about these really important issues. Allow me to share my screen, please. When we think about the role of nutrition in medicine, for many years, people imagined that nutrition was a rather modest thing. After all, here in the United States, people with high cholesterol levels were encouraged to change their diets. They were encouraged, for example, to stop eating red meat and to eat more white meat, or to take the skin off their chicken. And it turned out that that didn't really help very much. People who wanted to lose weight were told to just eat less. And by Wednesday, they had trouble continuing. And many people sort of gave up. They thought nutrition is not really a very influential thing. There's nothing much that we can do with it in the clinical setting. But things changed. And I want to give some credit to Dr. Dean Ornish. In 1990, Dr. Ornish published a very important study called the Lifestyle Heart Trial. And I'd like to walk you through this study and about other studies that it inspired. Dr. Ornish's goal was not to just prevent heart attacks. His goal was to see if the atherosclerosis that leads to heart attacks could be reversed. I'm going to show you some images. If the photo strip that you may have on the right side of your screen or across the top, if it's getting in the way, please feel free to just minimize it or drag it out of the way. I'd like you to be able to see these images. Dr. Ornish's goal was to see if that ugly looking artery at the bottom could turn into something more like that healthy artery at the top. And he didn't use surgery or medications. He used an experimental program with 4 steps: vegetarian foods, a half-hour walk every day, manage stress, which is why he didn't do this study here in Washington, D.C., where I'm speaking, and to avoid tobacco. And that was the whole program. He didn't use medications, not even cholesterol-lowering drugs. But after 1 year, the average person had lost 10 kilograms. Their total cholesterol and LDL cholesterol had dropped significantly. This is the kind of result you expect from medication, but this was done with diet and lifestyle alone. But what made really people to stand up and take notice was that everyone had an angiogram at the end of the study. And the results were compared with the angiographic results at the beginning of the study. And what became clear is that the arteries were starting to open up so much that you could see a measurable difference in 82% of the participants in 1 year. No medications, no surgery. And the longer people continued and the better they followed it, the better they did. And let me share with you what this looks like. This is a slide of a surgeon whose left anterior descending artery, as you can see, is severely damaged. That should look like a nice, smooth artery, but instead it's crinkly and narrowed by atherosclerosis. He was not able to be stented because the disease process was too extensive, and he could not tolerate cholesterol-lowering drugs, so he had no choice. For the next 32 months, he followed a low-fat, completely vegan diet with no medication, and here's the result. Once again, if you can't see this because if the pictures of us are getting in the way, please minimize them. I'd like you to see this. This artery has healed. Those atherosclerotic plaques have been resorbed with diet and lifestyle changes. Now, we're used to the body healing from a cut on the skin or a fractured bone. But could arteries heal? Evidently, yes, and other things as well. Our research team was inspired by this work and decided what would happen if we used a similar intervention in people who did not have heart disease, but just needed to lose some weight. So we brought in 64 overweight women and randomly assigned them either to a low-fat vegan diet. And when I say a vegan diet, I simply mean no animal products, no meat, not even chicken or fish, no dairy products at all, no eggs. But by low fat, I mean that even good vegetable oils were kept to a minimum, and in a bit we'll see why. They were compared with a conventional diet drawn from the National Cholesterol Education Program. We asked everyone not to change their exercise because we wanted to zero in on what diet alone could do, and it was a 14-week study. And what we found is that people responded very well to our guidance to eat fruits and grains and vegetables and legumes. And that meant they could have pancakes or oatmeal porridge or cantaloupe or rye toast or chili made not with meat, but with vegetables or pasta dishes, lots of things. And some people even discovered that there was candy that was vegan. Well, that wasn't exactly what we were suggesting, but we discovered that I guess that was allowed in our research protocol. So if they wanted it, that wasn't barred, even though that wasn't especially the most helpful food. But what we found was that after 14 weeks, the vegan group lost almost 13 pounds compared to the control group, which lost about 8 pounds. That was a significant difference. But what is more important is what happens over the long run. And what we showed is that in the control group, the weight that came off came right back. But in the plant-based group, the vegan group, the weight stayed off for the long term. Okay, fair enough. So at that point, the National Institutes of Health gave us a grant to test this with people with diabetes, comparing a portion-controlled diet and a plant-based diet. Now, the portion-controlled diet is going to be familiar to you. Limiting calories to help people starve off weight, to keep carbohydrates steady, and limit bad fats like trans fats or saturated fat. But the plant-based diet simply said no animal products, minimize oils, and favor low glycemic index foods. These are things like beans or foods that have carbohydrate, but it doesn't spike your blood sugar too much. You'll notice the plant-based diet does not limit calories, and it does not limit carbohydrate. You can eat as much calories and as many carbohydrate grams as you want. Well, what did we find? We tracked hemoglobin A1C and found that in the control group, A1C improved about 0.4 absolute percentage points. That's good. Well, what about this plant-based diet, the vegan diet? How well did they do? What we found is that after 22 weeks, their A1C dropped on average 3 times more than the portion control group, on average 1.2 absolute percentage points. Okay, so what we've now established is that this diet that doesn't limit calories and does not limit carbohydrates, but does kick out animal products, is far more effective than a more conventional diet for blood sugar control. Let me share with you a case. 35-year-old man joined our study. He had had diabetes for 4 years. He was treated with metformin, 500 milligrams twice a day, but he had other problems too. He had excess weight, his blood lipids were up, and he had erectile dysfunction. His family history was not so good. He told me about his maternal grandmother and his maternal grandfather, both of whom had complications of diabetes. His father was dead by age 30. He said, I need to get this together. So he began a low-fat, plant-based diet, the intervention diet I described. His weight at the beginning was 276 pounds. That's 125 kilograms. His A1C was 9.5, which is not where we want it. His cholesterol and LDL were up, and he had erectile dysfunction. So he began avoiding animal products, minimizing oils, favoring low glycemic index foods. And 3 months later, he had lost, what's that, about 11 kilograms? Fair enough, that's a good start. His A1C was down to 7.1%, and his erectile dysfunction had gone into remission. At 14 months, he was now down to 99 kilograms, so he'd lost 26 kilograms. His A1C had dropped from 9.5 down to 5.3. His lipids were better, and his erectile dysfunction remained absent. The thing to pay attention to is an A1C of 5.3%. When I was in medical school, I was taught that diabetes never goes away. Once you've got it, you'll have it forever. Well, here was a man who was not on any medications anymore. His A1C was 5.3. And I ask you, does that man have diabetes? He could go into any clinic in the world and he would not be diagnosed as having this disease. So we began to realize that type 2 diabetes is a two-way street. You can get it, you can reverse it. Don't get me wrong, not everybody has a terrific result. For some people, they'll improve, but they may still need some medication. But what we want to do is give them every chance to be cured and to go as far as they can. So let me show you about how insulin functions. This is a cell. Let's say this is a muscle cell. Now, muscle cells function on glucose. That's their fuel. And the glucose is in the bloodstream all outside the cell. To be effective, the glucose has to get in through the cell membrane into that cell to power it. But unfortunately, the glucose molecules can't get through. They can't get into the cell. Now, there are channels that are closed. So what does the body use? The body uses a key made in the pancreas called insulin. And that insulin key goes to the surface of the cell and it signals those channels to open up. Okay, fair enough. Now the glucose can come in and that's just great. Everything's going swell. Well, what's the matter here? What goes wrong? I grew up in North Dakota and that was our dinner. And that was our lunch and that was our breakfast. We ate all kinds of animal products and oily foods. And these foods contain a lot of fat. Even chicken without the skin is about 23% fat as a percentage of calories. Chinook salmon is over half fat. So what does fat have to do with diabetes? Let's go back to that cell. If you eat fatty foods like meat, cheese, and other dairy products, or cooking oils, the fat particles start building up inside the cell. And as these fat particles build up, insulin no longer works. Now, doctors don't like a nice short word like fat. It has only 3 letters. So we'll call it intramyocellular lipid to sound more scientific, but it's just fat. Fat inside the muscle cells, and it's also inside the liver cells, hepatocellular lipid. And it stops insulin from working. The insulin key still attaches to the cell, but the signaling does not work because the cell is filled with microscopic fat particles. So the glucose stays outside. Any glucose that I consume, any starch that I consume causes my blood sugar to rise, but that was not the cause. The cause was fat building up inside the cell because of the fatty food choices that I made. So let's go on a vegan diet that has no animal fat in it at all. And let's limit vegetable oils to the bare minimum. And what we discover is that these fats start to dissipate. And when the fats go away because I'm not eating them anymore, the intracellular signaling resumes. And now the glucose can come out of the blood and my blood sugar comes down and it improves. And maybe my diabetes even goes away. Not because I've been counting calories, not because I've been limiting carbohydrate, but because I took the fat off my plate and the fat comes out of the cells and now my insulin can work. Amazing, isn't it? Now, let me go back and share with you the science that led to this new understanding. Going back to 1996 at Yale University, researchers brought in young people and hooked them up to a lipid infusion. What I mean by that is the volunteers had an intravenous line put into a vein, and fat was dripped into their veins. And then the researchers tracked their insulin sensitivity. And what they showed is that their insulin sensitivity diminished not within weeks or within days, but within hours. You can develop insulin resistance in one afternoon. Now, you might say, well, of course, we don't have fat infused into our veins. We might eat fat. Okay, well, let's test that out. Now, at the German Diabetes Center, researchers gave palm oil to individuals in a single meal. And they found that, yes, that causes insulin sensitivity to diminish. Now, palm oil is a particularly unhealthful fat. It's very high in saturated fat. I hope you're never eating palm oil or coconut oil because they're really both high in saturated fat. So let's try a healthier oil like canola oil. What do we find? Basically the same thing, that canola oil and any other fat will tend to impair insulin sensitivity. So the answer for patients with type 2 diabetes is to get the fatty foods out of their diet, get the animal products out of their diet, build the diet from vegetables and fruits, whole grains and beans, and you have a chance at helping that patient to cure. Now, you might ask, what about type 1 diabetes? Type 1 diabetes is a condition where the beta cells of the pancreas have stopped making normal amounts of insulin. So in these cases, a person is going to need to inject insulin. What's the role of nutrition? Well, the first thing is just because you don't have insulin or very little insulin being produced, that doesn't mean that you can't also be insulin resistant. If a person with type 1 diabetes follows the diet that I have just described, what they will typically find out is that their requirement for insulin goes way down. They feel much better. They lose unwanted weight, and they need less insulin, both basal and at mealtime. The other role for nutrition in type 1 diabetes is in addressing the question, why is the insulin gone? What's happened to the beta cells? Well, as you probably know, type 1 diabetes is an autoimmune condition, meaning that the body is making antibodies that have destroyed the beta cells that would make insulin. Where do those antibodies come from? A substantial amount of evidence suggests that at least in some people, those antigens that trigger the antibody response are dietary antigens. Dairy proteins, perhaps other kinds of proteins. What we believe is that if children are never exposed to cow's milk proteins, that the risk of type 1 diabetes may well diminish. We would suggest that all babies should be breastfed, and they should be breastfed by a mother who does not drink dairy products, because dairy proteins will pass from her digestive tract into her milk and hit the child. Okay, let's shift gears. We've talked about the fact that we can control a hormone, insulin, by dietary choices. Let's try that with another hormone. How about estrogens, female sex hormones? Well, I was sitting here at my desk some years ago, and the phone rang, and it was a young woman who said, Dr. Barnard, I've got terrible pain. Many women have menstrual cramps every month, but for about 1 in 10, those cramps are so severe, they can't work, they can't travel. And that was her situation. She wanted heavy duty painkillers. And I said, sure, I'll give you some painkillers for the next 2 days. But how can we stop this condition from recurring next month and the month after that and the month after that? And I started to think about what menstrual cramps really are. I'd like to walk you through this. And as I'm speaking about menstrual cramps, see if the similar mechanisms might not relate to more serious conditions like hormone-related cancer. But we're getting ahead of ourselves. Okay, so this is the uterus. Off to the side, you see the ovaries. And in the very center of the screen, you see the endometrial layer, that pink lining. And every month, under the influence of estrogen, that lining thickens up in anticipation of pregnancy. Well, what I was guessing was happening with this young woman who had so much pain was that she had too much estrogen in her blood. That estrogen is estradiol. That's the main estrogen in young women. And if you have too much estradiol causing that uterine lining to thicken up, at the end of the month, it disintegrates and releases prostaglandins, which cause pain. Now, there's another possibility, and that's endometriosis. This is a condition where the endometrial cells have escaped. They're now outside, and they look like little raisins, those little dark patches. Those are endometrial cells that are all outside the uterus. They're packing onto the ovaries and the fallopian tubes and elsewhere. And every month they swell in response to estradiol, they bleed, and they scar. So when she was talking about her experience, I happened to remember a study from Tufts University. Researchers brought in 48 women into a metabolic ward where everything they ate was carefully controlled and monitored. They asked them to do diets, a series of diets, each one lasting 8 to 10 weeks. Some reduced fat, some increased fiber. And what they were looking at was, would estrogen levels be altered by the diet? Now, they weren't thinking about endometriosis or dysmenorrhea. What they were thinking about was breast cancer. Because if I can control estrogen levels, maybe I can control breast cancer risk. What they discovered was the effect of just reducing fat, nothing else, just reducing fat. When you do that, that reduces the levels of estradiol, estrone, free estradiol, and estrone sulfate. What about fiber? Well, when I increase fiber, that does the same thing. That reduces several estrogen levels. So when this young woman called me and said, I feel terrible, I've got terrible cramps, I thought either she's got primary dysmenorrhea or endometriosis. In either case, they are driven by estradiol. Let's bring her estradiol level down naturally with food. So I suggested to her 2 things. How about no animal products for the next month? Minimize oils for the next month. And she agreed to try. And you can see what I'm doing. If you're eating no animal products, then everything you're eating is a fruit or a grain or a vegetable or a bean or something that has fiber in it. Animal products have no fiber. And if we minimize oils, then we are really reducing all forms of fat. So we're doing what they did at Tufts University, only doing it to the maximum. So everything you eat has fiber and there's very little oil. She reported an amazing experience. After 4 weeks, she called me up and she had gotten her period with no symptoms at all. And the next month after that, same thing. And the next month after that, same thing. She was effectively cured until she loosened up her diet and then the pain all came back. So I did a research study to see if this was really true for a broader number of people. We brought in 33 young women and half of them went on the diet I just described. No animal products, keeping oils really low. The other half got a supplement, which was in fact a placebo. After 2 months, everybody switched. The diet group began a supplement, the supplement group began the diet. And what we found was, in a nutshell, it works. We reported our findings in obstetrics and gynecology, and we showed that pain intensity diminished, pain duration diminished, and premenstrual symptoms like bloating and water retention all diminished as well. Okay, let me share with you the experience. This is a real person who I will call KL. She grew up in Louisiana and she was in the US Air Force. In 2003, she was sent to Iraq. And when you're in a war zone, and she was there building military bases and so forth, working very hard and eating only what the government provided, you don't eat very well and you don't gain any weight. But when she finished her tour of duty and went back home, her family decided to take her out and to make up for all the foods that she had missed while she was overseas. She missed macaroni and cheese snacks, cheese, everything. A friend of hers bought her 48 boxes of macaroni and cheese dinners. I'm not making this up. She ate them for 48 days straight. Well, what happened? Well, she gained weight, but she also started to develop pain in her abdomen that turned out to be endometriosis. It causes severe pain and it can also leave you infertile. Now, her doctor tried many treatments. The doctor gave her painkillers. The doctor gave her hormonal treatments. Nothing really knocked out the pain. Finally, the doctor suggested, well, there is one other treatment. We could do a hysterectomy because if we just take everything out, your pain should be gone. Well, Catherine was 27, and she and her husband were sort of newlyweds, and she really wasn't too keen on the idea of having her uterus removed. But the doctor explained to her, well, you weren't going to have children anyway because your endometriosis has almost certainly made you infertile. You've got nothing to lose but your pain. Go ahead, have the surgery. Well, they couldn't schedule the surgery for another 6 weeks. But in the interim, she tried something else. A nutrition counselor told her about the diet that we had tested, getting away from animal products, minimizing oils. And she discovered that she felt better. It helped her to lose weight, and her pain diminished and diminished and diminished. She felt dramatically better. But she wasn't perfect. There was still a little bit of pain left. So she decided, all right, I may as well have the surgery, and then at least that little bit of pain will be gone. So she went to the operating room. And in the operating room, they put her to sleep. And an hour later, she woke up. She was in the recovery room. And the doctor was there, and he said, wake up, I need to tell you something. I opened you up, and I could see that your endometriosis was practically gone. I don't know why, but it's practically gone. And the reason that you had some residual pain was that you had scarring where the endometriosis used to be. And that scarring created adhesions. And all I did was free up those adhesions. And I think you're going to be fine. I didn't do the hysterectomy. You still have your uterus. I just left it there. But I still can't figure out why your pain went away. Or why you're feeling so much better and why your endometriosis went away. And her mother was in the recovery room with her, and her mother said, well, doctor, she went vegan. And the doctor said, stop it. There is no way that a diet change is going to cause or cure endometriosis. Food doesn't cause this disease. Food doesn't have anything to do with it. Well, he decided this was just some miraculous cure, probably wrote that in her chart. Now, I want to praise that doctor for not doing the hysterectomy. However, he missed what a lot of doctors miss, which is that nutrition is a powerful force. Nutrition can reduce estradiol levels. When it reduces estradiol levels, it reduces the fuel behind the endometriosis process. And that is the most likely reason why her condition went away. She lost a lot of weight, felt much better, and as fate would have it, she is not infertile. She had 3 children after this. And she decided to dedicate her career to educating other women about things that they can do to protect their own health. Now, I mentioned that she liked cheese. Does cheese have hormones in it? Well, cheese comes from milk. Milk comes from cows. The animals are impregnated every year in a not very kind way, and the animals are pregnant for about 9 months. Now, when they are pregnant, they are milked during their pregnancy. They're impregnated every single year, and so they are milked during the succeeding pregnancy for some months into the pregnancy. A cow who is not pregnant makes estradiol. A cow who is pregnant makes a lot of estradiol, and it gets into the milk. So if you drink milk from a cow, you are drinking estradiol. If you feed this to your daughter or your son, you are feeding them estradiol. Let me make sure you understand what I'm saying. Cows make estradiol, it gets into their dairy products, and if you eat milk, cheese, yogurt, any dairy product, ghee, then the estradiol is getting into those products and you're consuming them in biologically significant amounts. There is no such thing as hormone-free milk. Well, does this really matter? Researchers have looked at the causes of breast cancer. And what I'm showing here is along the y-axis, quintiles of estradiol levels. The further you go to the right, the higher the amount of estradiol in a woman's blood. The y-axis here is breast cancer risk. And as you can see, the higher the estradiol level, the higher the breast cancer risk. That's exactly what you'd expect, because estradiol influences the growth of breast cancer cells. Now, in Australia, researchers wanted to track, does dairy really affect estrogen levels? And they looked at women who consumed no dairy servings or 18 servings per week, 32 or 48 servings per week. 18 servings per week, as you can imagine, is 3 or 4, maybe 2 or 3 servings of dairy products per week. And what they showed very clearly is that women who avoid dairy have healthier, lower estradiol levels compared to women who consume a lot of milk. Put the other way, milk and other dairy products boost estradiol levels in an area you don't want. Now, this is among breast cancer patients, high-fat dairy products and mortality. And what you can see is those women who avoid high-fat dairy products have much lower mortality. Those who eat a lot of high-fat dairy products after a breast cancer diagnosis have about a 50% higher risk of dying of their cancer compared to women who avoid dairy. So our message here, dairy products is not something that's good for you or for the cow or for anybody. It's a good thing to avoid entirely. Okay, by the way, this helps us explain why body mass index is related to breast cancer. You've known this for a long time, that people who are heavier with a higher BMI, that's further right to the right on the on the x-axis, have a higher risk of breast cancer. That's the y-axis. Well, part of the reason is that fat cells make estradiol. So the more a woman gains weight, the more estradiol in her blood, the higher her risk of developing breast cancer and the higher her risk of dying of it. Okay, does diet play a role in cancer after diagnosis? The Women's Intervention Nutrition Study did a very simple thing. They brought in more than 2,000 women, all of whom had breast cancer, and they simply reduced the fat in their diet. Less animal fat, less vegetable oil, and they showed that the risk of a recurrence was diminished by 24%, and that was true both for estrogen receptor negative and estrogen receptor positive cancers. Lowering the fat intake reduces the likelihood that cancer will recur. The Women's Healthy Eating and Living Study did the opposite. Instead of cutting fat, it decided to boost vegetables and fruits. What they did is they brought in a large group of people, more than 3,000 women. They all had breast cancer already, and half of them were asked to have 5 servings of fruits and vegetables. The others were asked to have 8 servings of fruits and vegetables every day. Now, at first, the researchers found that both diets seemed to have about the same effect. They were discouraged by that. They thought, well, maybe diet doesn't matter. But then they realized, hold on, here in America, nobody eats 5 servings of vegetables and fruits a day, let alone 8. And maybe both groups are getting an effective intervention. But then they did another analysis that was really fascinating. Looking at within the 5-a-day group, the comparison group, they looked at those women who increased their vegetables and fruits very high and were physically active. And their mortality was less than 5% over the following 5 to 11 years. Now let's compare these women with a healthy diet and who are very physically active with those who did not get so much in the way of vegetables and fruits. They still got some, 3 servings a day, and they were physically active, but their mortality was double, more than 10%. Those women who got vegetables and fruits but were physically inactive had a mortality of 10.7%, and those who got less physical activity and less vegetables and fruits had a mortality approaching 12%. What this suggests to us is lowering fat, great idea, as we saw in the women's intervention nutrition study, but boosting vegetables and fruits and boosting physical activity, that's also a good idea. You can do them all together at the same time. This is the city of Chicago in the center of the United States. And there researchers decided to test the effect of diet on something else, Alzheimer's disease. They brought in a large group of people. They tracked their dietary intake from day to day. And what they found is that those who ate the most saturated fat had far more Alzheimer's disease compared to other people. Saturated fat is the fat that's in dairy products, milk and cheese, but also in meat. Now, let me show you the numbers. Some of the participants ate relatively little saturated fat, about 13 grams a day. Others got about twice as much, 25 grams a day. And as you can see, the risk of Alzheimer's disease in the low-fat group was less than half that compared to the high saturated fat. Now, it's easy to get saturated fat. Eggs have it, bacon and other meats have it, chicken has a lot of it, milk has a huge amount, and if you're eating pizza, which unfortunately is now a worldwide pandemic, the pizza inflicts you with all kinds of saturated fat. And with just those foods in the course of the day, your average person ends up in the high-fat group, the high-risk group. Okay. Now, it's not just Alzheimer's disease, though. An earlier stage of cognitive decline is called mild cognitive impairment. Researchers in Finland brought in over 1,000 people, and some of them ate relatively little saturated fat, some ate a lot. And what they were tracking them for was not Alzheimer's disease, but just mild cognitive impairment, forgetfulness that we see in older people. They started when people were averaging about 50 years of age and tracked them for the next 21 years. And what they found was indeed those people who were avoiding the saturated fat did much better. They did something else, though. They then compared those people, limited the analysis to those people who were at genetic risk because they had the ApoE epsilon 4 allele. You know this gene. This is the one where if you got it from your parents, your risk of Alzheimer's disease is much higher. But they found that comparing those people who ate relatively little saturated fat and those who ate a lot, even if you have the gene, those people who tended to avoid saturated fat, that's dairy fat and meat fat, those who avoided it had 80% less risk of mild cognitive impairment compared to the others. So we're starting to see that there are strategies, not just to protect the heart, not just to reduce cancer risk, not just to prevent and reverse diabetes type 2, and also to improve type 1, but perhaps even to protect the brain. Why would that be? Well, it turns out that if you compare people with high cholesterol levels, that's along the x-axis here. This is a study of almost 10,000 people from Kaiser Permanente Health Plan here in the United States. Those people who had the highest cholesterol levels had the highest risk of Alzheimer's disease. What we believe is happening is that what's bad for the heart is bad for the brain. And if you have a high cholesterol level, it damages both the heart and the brain. On the other hand, let's say I decided I'm going to eat plants, I'm going to give the animals a break and leave them off my plate. That's good for the heart and very good for the brain as well. All right, the last thing I'd like to talk about today is the process of change. When people come in and they say, I would like to lose some weight, I'd like to get my cholesterol down, I would like to improve my diabetes, or if possible, get rid of it. We encourage everyone to choose fruits and grains and legumes and vegetables and all the wonderful foods that they turn into. It's also important to take a vitamin B12 supplement. You need vitamin B12 for both healthy blood and for healthy nerves. You only need 2.4 micrograms a day, but you need this. It is fortified in a few foods, but you may not be eating them. It's a much better thing to have a supplement that can either be a daily multiple vitamin or just a B12 supplement of, say, 500 micrograms, something like that will be more than enough. Okay, now, if you explain to a patient that this is a good idea, I'm sorry to tell you, you may not get too far because logic plays almost no role in human behavior. You know what I'm talking about. When you look at the first decision that people make in the morning, what should I have for breakfast? They don't tend to think logically. Okay, I should have 7 or 8 grams of fiber. I should have beta carotene rich foods. I should have healthy fresh fruit. No, no, no. That doesn't cross their mind. They're going to eat based on what I call noise. What's advertised on television or on culture. In other words, what they grew up eating, or what their friends eat, or what their parents ate. Or maybe they have some wishful thinking, if I eat this or that, it'll help me. Or maybe they're addicted to certain foods. Logic doesn't come into it very much. So we have a certain way of helping people adopt a healthier diet that does not depend on logic. And let me share with you how we do this so that you can do this with your patients or in your own family, if you like. Here's what we do. The patient comes in and they say, I don't know what to do, but I don't want to, I've got diabetes. I don't want to be on insulin. What can I do? What we'll say to them is, first of all, we will take 2 minutes and explain how fatty foods cause fat to get into their cells and stop insulin from working. Patients understand that very easily. So then the next step is, let's think through what a diet would look like that would help me. Now, the patient will say, I'm not sure if I want to change my diet in any big way. You say to the patient, let me see if I can cure you. So we are going to make some big changes, but we're going to focus just on the short term and see how this really works, because I want to see what diet will really do for you. The patient will say, okay, I'm in. What do we do? You say to the patient, for the next week or so, you don't have to change your diet at all. But what I'd like you to do is think about foods that you could eat. Think about foods you would eat if you didn't eat animal products and if you kept oils pretty low. So make an appointment with the patient to come back in a week. And during that interval, give them a piece of paper and say, fill this out. I want you to think about foods that have no animal products for breakfast or lunch or dinner or snacks, and give them some ideas. So there are lots of foods that fit the bill, but they have to think about them. Then we always ask them to sit down with our registered dietitian and think through, okay, do you like oatmeal porridge? Well, maybe not, but I have to put some berries on it or cinnamon, that'll make it taste good. Okay, fair enough. What can I have for lunch? I can have a veggie burger, or I can have a pizza without the cheese or whatever. Their job in the first week is just to make the list. So they go out to eat and they go to an Italian restaurant and they discover that they can have the spaghetti without the ground beef sauce, but instead they'll have it with a tomato sauce. And at the pizza restaurant, they're happy to leave off the cheese. Okay, well, that's easier than I guessed. Or they go to a Latin American restaurant and they have beans and rice. Or they go to a Chinese restaurant and there's tofu and vegetables. And there are many, many choices. Every kind of cuisine has these. And of course, needless to say, in Sri Lanka and in the Indian subcontinent, there are many, many, many wonderful grains, lentils, beans, vegetables, fruits that fit the bill very nicely. Now, some people eat fast food and they go to a submarine sandwich shop. If that's where you go, fair enough. Will they make you a veggie sandwich? Let's see. After a week, the patient comes back in And they say, this is really easy. All you asked me to do was make a list of foods, and I've got my list. Here it is. What do you think? And it'll be a good list. Now their job is to take the next 3 weeks and to say, let's eat those foods. You picked them out. Let's do it all the way. And keep in touch with them every week and see how they're doing. If they have a problem, you can help them solve it. And at the end of this 3-week period, 2 things happen. One is they feel better. They're losing weight. If they have diabetes, their blood sugars are coming down. You may already have had to reduce their medications. That's very common. They may have even become hypoglycemic if they're on insulin. Well, they're happy about that because it means that you're going to stop their insulin or reduce it. Great. Be attentive to that because hypoglycemia can occur quickly. The other thing that happens is that their tastes are changing. They no longer want fatty foods. Their taste for them has kind of gone away, and they like the new foods that they've discovered. And so after 3 weeks, they want to keep going, and they want to continue to lose weight and continue to feel better, continue to throw their medications away. So give them that opportunity. We have lots of resources for you. We have an app called the 21-Day Kickstart. It's the 21-Day Vegan Kickstart, and you'll see it online. It's in English, it's also in Spanish, and it's free. It's got menus and recipes and cooking videos. And our nutrition guide for clinicians is now free, and it is online. You can go to Nutrition Guide for Clinicians. Just type that into Google and you'll find it. And you can look at diet and diabetes, diet and Alzheimer's disease, diet, and about 90 other conditions. We have continuing medical education that you can register for and take. Much of it is free. And we have a program where everybody who comes here to Barnard Medical Center, on the way out the door, we ask them to pick up this little paper and to shoot that little QR code. And you could shoot that now with your phone if you like. And what you'll see is it brings you to a site called foodinstructions.org. And it gives you little videos that talk about the things that I've been describing today. So, because the patient couldn't remember it all after we spoke. So we say, go to this website and you'll see the same information in short little cartoons, easy for you to remember. So please use this. It's free. Let me ask you to take advantage of it. You can go ahead and shoot that if you like. It's foodinstructions.org. So let me stop at that point. And I want to just say thank you to all the caregivers who are here today, because being a doctor these days is not so easy, because we have the food industry sometimes lined up against us. And we have the fact that maybe we ourselves grew up with some ideas about food that might not be exactly current. That's okay. If we put this to work, if we put this healthy approach to work, we can help our patients. And most importantly, we can help their children from having the same problems that they have had. So you're helping your patients, you're helping the next generation too. Thank you very much.
Thank you so much, Dr. Wonderful lecture, lots of information, and I'm sure people have gained a lot of knowledge with this. Doctor, I have a question. I think I will hand over the forum to other doctors, but the first one is keto diet. Now in Sri Lanka nowadays, there's a group of people actually is promoting high fat, low carb diet. They have given a different name to that, but it's basically 80% of fat and 20% of protein diet. So what do you have anything to say about it? And they, of course, they say it is it's reducing the diabetes and also the weight. So what can you say about it?
Yes. This diet has been around since the 1950s in other names, the Atkins diet, the South Beach diet, ketogenic diets. And carbohydrate-rich foods are more than half of what people eat. If you're eating beans or fruits or grains, they're very rich in carbohydrate. And it's natural that people would eat these things because they provide the glucose that our brain uses and their bodies use. So these diets artificially say, well, just stop eating all of those things. Don't eat grains, don't eat beans, don't eat fruits. And what's left over is fatty foods and meat. Now, it does have a couple effects. The first effect is because more than half the calories you eat are carbohydrate. If you take out all of those foods, many people lose weight. Not everybody does, but many people will lose weight. The other thing is because you're taking out the carbohydrates, your blood glucose is likely to drop because you're just not providing the glucose in your blood. However, the problem is you're not really addressing the real issue. The issue is the buildup of fat inside the muscle cells, and the foods that are left in your diet are the worst foods. So a number of these people, although weight loss is a good thing, a number of these people end up with high cholesterol levels and are at a higher risk of heart disease, and they're eating the very foods that increase cancer risk as time goes on. So we don't recommend a ketogenic diet at all. What we find is that we get results that are better, and we're using foods that are more in sync with human biology by using a plant-based diet. But thank you, that's a terrific question.
Thank you, doctor. Is it harmful really? Is it harmful long-term or short-term to the body?
A ketogenic diet?
Yes.
Let me tell you a story. There was a case report that we published. There was a man here in the United States who was just a few pounds overweight. He wasn't heavy, but he was a few pounds overweight, maybe just 3 or 4 kilograms overweight. And he wanted to trim it away. And this ketogenic diet was very popular. So he thought, well, I'll give that a try. And he believed what he read, which was that it's safe to throw out all the carbohydrate and to eat a diet rich in meat and fat. So he started doing this. But unfortunately, and he lost some weight because he was not eating most of the foods he normally ate. But a few months later, he was walking down the street and suddenly had crushing chest pain. He went straight to the emergency room and he had a very serious heart attack. And what he realized was that because he had believed this diet and had imagined that the rise in cholesterol levels, his cholesterol level, that came from eating meat and so forth, that caused the heart attack. So he switched his diet. He went to a plant-based diet. He was able to maintain his health and get his cholesterol back down. Unfortunately, this is not an exceptional case. When you look at research studies of people doing ketogenic diets, normally weight loss by any means will lower cholesterol levels. But maybe 1 in 3 people on a ketogenic diet has their cholesterol levels go up. So it's a risky thing for a great many people. Plus, gastrointestinal type of cancers, particularly colorectal cancer, and hormonal cancers like breast cancer or prostate cancer are fueled by the very foods that are emphasized in a ketogenic diet. So it's not something that we recommend at all.
Okay, doctor. Thank you. Thank you very much. Now I actually invite Dr. Rohan De Silva. Doctor, you have any questions for Dr. Neal Barnard? You can unmute and we can keep the video on and speak. Yeah.
Thank you very much, Ananda, and thank you very much, Dr. Neal Barnard, for the very insightful presentation. My question is, I being from a psychological background, I just want to focus on that. We know that our gut is our second brain, and there is established evidence the gut-brain connection in terms of neurotransmitter well-being and the flora of the gut. So in terms of that, can you elaborate and add something on how a vegan diet would be more supportive on the lines what you spoke, because this was especially focused on the diabetes track, but in general, how a vegan diet will support the gut flora or the neurotransmitter well-being, and then any relevance on the diabetics dialogue.
Oh, thank you for that very wonderful question. I think you're really very much on the cutting edge of science right now. Some researchers about 3 years ago published a fascinating study here in the United States, where they brought in a large group of individuals in the United States and analyzed their gut microbiome, and they quantified the various gut bacterial species. Then after that, they also brought in a group of individuals from rural South Africa who were eating a diet very, very different from that in the United States. It was heavy in root vegetables, and it was very inexpensive, mostly plant-based foods. And what they showed is that they had a much healthier gut microbiome. They then asked the individuals to switch their diets so that the people in South Africa started eating the American meaty diet. And they showed that their gut microbiome started to degenerate very rapidly. But the individuals in the United States who started to eat the diet in rural Africa, beans, root vegetables, whole grains, found that their gut microbiome started to get dramatically healthier. And within 2 weeks, you could see a very major change in the gut microbiome. Now, the gut microbiome is being studied for all kinds of things, some of which you touched on just now. Brain health seems to be influenced by both neurotransmitters that are created within the gut and also by other factors that are created in the gut that have brain effects. Many other things are affected by the gut microbiome. The point here is that the gut can be affected very, very rapidly. What are the key points? The key points are high fiber, high carbohydrate, protein limited to plant proteins, and minimal fat. That gets the gut microbiome going in a good direction. So thank you, Dr. De Silva, for a very important question.
Thank you very much, Dr. Neal. I appreciate it.
Sure.
Now I request Dr. Haris Patrege if you have any questions.
Yeah, congratulations for your excellent lecture. I'm a pediatrician. I just want to ask one question. Now, we have seen increased number of diabetes in neonates, infants, and early childhood, even in Sri Lanka. I know it's worldwide also the same. What is the effect of mother's nutrition, especially if you have any research data about the vegan diet on mothers during pregnancy, as well as in early breastfeeding period of and developing the newborn or the infant or child diabetes later, the effect of mother's dietary pattern and the development of diabetes in children, especially the early onset.
There are a couple of effects that we're seeing with women who follow a healthful diet during pregnancy. The first is that the woman herself is less likely to develop gestational diabetes, which is a good thing, and also less likely to have preeclampsia. There was a very large study done of a large community where a huge number of people were following a plant-based diet, and the risk of preeclampsia was extremely low. So what we believe is that during pregnancy, a plant-based diet is optimal. Now, let me be clear. When a woman is pregnant, we want to make sure she has complete nutrition. So that means a variety of fruits and grains and vegetables and legumes. Plus, make sure she's getting plenty of green vegetables so that she gets a good, healthy source of calcium. And she should be supplementing her prenatal vitamins. Vitamin B12 is something that she needs to have and her developing baby needs to have. So these things are not optional. It's important to have. Now, from the standpoint of the baby, there are a couple of things in maternal nutrition that are going to be very helpful with this kind of diet. The first is that the mother is not taking in antigens that are going to be problematic for the child. We've seen this even with breastfeeding children. When the mother is not drinking cow's milk, then the cow's milk proteins are less likely to enter her milk and less likely to bother the child, as you can see what I mean. So this process can even begin in utero, we believe. So the cleaner the diet for the mother, the less antigens are presented to the infant. There's one other thing. We want weight gain during pregnancy, but we don't want excessive weight gain. We want the right amount of weight gain for a healthy mom and a healthy baby. And that's what we tend to see with a plant-based diet, that the mother is able to have her homeostatic appetite control work much, much better, and she's less likely to get into these more metabolic derangements that can otherwise occur. That said, pregnancy is a complicated time when things can sometimes go wrong. And so the mother needs to be under the care of a good obstetrician, and the pediatrician needs to stand by. So they will still need your care and your attention. But a good, healthy diet is best for both mother and child. So thank you for that very good question.
Yeah, thank you.
Sure, thank you.
Thank you, Dr. Kumudu Dahanayaga, do you have any questions for Dr. Barnard? I think he was in a different little remote area, some problem with the signals. Doctor, let me ask another question posed by another participant here. He was asking about the vitamin B12. I think you touched upon that, and also essential amino acids and vitamin K2 with a plant-based diet.
Okay, well, vitamin K is, of course, abundant in plant foods. With regard to the essential amino acids, up until fairly recently, many people imagined that of the essential amino acids, that some of them might be missing in one plant food or another. It turned out not to be the case, but the myth was that, say, corn might be very low in one amino acid and beans might be very low in another amino acid. And in order to get complete proteins, you had to make sure that you ate them both together. Now, eating them together is a good idea, but let me be clear. All plants have all the essential amino acids. So it's not as if some are deficient in one or another. They, all of them have all the essential amino acids. And this was something that was discussed in great detail at the recent International Conference on Nutrition in Medicine here in Washington, D.C. And the importance of this is back in 2016, researchers looked at what happens if you're getting your essential amino acids not from plants, but you're getting them from animal products like eggs or chicken or red meat or whatever the case may be, or dairy products or fish. And researchers at Harvard University in 2016 published an important paper showing that in large groups of people, those who derive their essential amino acids from animal sources have a higher mortality, or to put it the other way, they have a lower life expectancy compared to people who get their amino acids from plants. So and why would that be? Part of the reason could be that animal products tend to have saturated fat and cholesterol going along with them, and that's going to threaten your health. That's probably, well, that's certainly true. But even when you control for that, you still see that when people get their protein from animal sources, they have worse mortality. So the other possibility could be that certain essential amino acids, when they are overconsumed, as they may be in animal products, methionine, for example, that if you're overconsuming some of these essential amino acids, they may be associated with higher mortality. Stay tuned. What we know for now is that people who get their essential amino acids from plant sources, which is easy to do, any normal variety of grains and beans and vegetables and fruits gives it to you, those people have much less likelihood of mortality within any given period of time. So essential amino acids, very important. Plants have them all.
All right, thank you so much. And Dr. A.U. Vijayratha, you have raised the hand and you can unmute and speak up.
Dear doctor, fish oil has been introducing in various parts of the country. So can we be informed about the modern information about it?
I'm sorry, I missed the first word.
Fish oil.
Oh, fish oil. Is it fish oil supplements? Well, these are commercial products that have been marketed really most vigorously as a way to approach heart health. And the idea is that if you get your omega-3s from fish, these are EPA and DHA in particular, that ought to be protective of the heart. But the studies have not really shown that to be the case, that people getting more omega-3s from fish oil supplements tend not to have better heart health. The other thing has been to see if they are useful for preventing Alzheimer's disease, and there so far we don't have any evidence of success. There's one peculiar thing. In some of these supplementation trials, we're seeing that people consuming the most fish oil have a higher risk of prostate cancer. Now, when that data first came out, I don't know, maybe 6 or 8 years ago, we thought it was just a fluke. We thought it couldn't be because we couldn't figure out why fish oil should cause prostate cancer. But many studies, one after another, has shown this to be the case. So now we believe that it's a real association, but we still don't know why. So the bottom line is, I am prepared to believe that supplementing with omega-3s could reduce the risk of Alzheimer's disease. We don't have any good evidence that it does, but it's possible. But it also appears to increase the risk of prostate cancer. What I would suggest is, if you are supplementing, I would suggest that you supplement with DHA and EPA that is from plant sources. You'll see them online. You say, just type in vegan DHA or vegan EPA, and you'll see that it's exactly DHA and EPA, but without any of the fish contaminants.
Doctor, on the same subject, now we can get essential amino acids through algae, right? I mean, it's in the market.
Yes. Yeah, that's exactly right. In fact, that's really the.
Is it better than the fish oil?
Absolutely. Yes, great question.
Thank you, doctor. Okay, now move on to Aruni Malwata. Aruni, I think you are a doctor also. Please unmute and speak up. You are muted. Please unmute.
Hi.
That's fine.
I would like to know whether B12 supplementation is necessary, or are there any other supplementations are necessary with the vegan diet, especially B12?
Okay, just to make sure, first of all, thank you for your question. Just to make sure I understood, you're asking if we need B12 supplementation or any other kind of supplements on a vegan diet?
Yeah, that's right.
Okay, B12 supplementation is required. Now, there are some foods that are marketed that do have B12 added to them. You'll see it in breakfast cereals, some baked goods, and other things. But it depends really sort of country by country, and it may not be written on the label. So I would suggest not depending on supplemented foods. But B12 is something that's widely available at pharmacies, and it's a very easy thing to get your hands on. So I would strongly encourage anybody who is on a vegan diet that they should be supplementing with B12. This is true for pregnant women, it's true for children, true for adults, true for everybody. Now, unless that sounds rather demanding, in the United States, the government encourages everyone to supplement with B12 after age 50, no matter what kind of diet you're on. And that's because many people don't absorb B12 very well. So even though meat and dairy has B12 in it, many people don't absorb them very well. But with a supplement, the absorption is much higher. So B12, number one, that's very important. The next thing, well, that's the only vitamin that I think everybody should be supplementing with, but I'll mention a few others that people ask about. One is vitamin D. Now, if you're at a nice sunny place, you're getting vitamin D from nature's source, which is sunlight on your skin. And if you unfortunately live in, say, a Nordic country where from January and February and March and April, there may not be very much sun, then you may need to supplement vitamin D. A typical regimen would be 2,000 international units per day. That's higher than the typical recommended daily allowance, but that's a level that most doctors would be comfortable with. Some people would recommend supplementing with iodine. Iodine is naturally in sea vegetables, and there's lots and lots and lots and lots of it. If you're not getting that source, some people would recommend using an iodized salt. Iodized salt is very common in certain countries, less common in others. If you're avoiding all of those sources, then some people recommend an iodine supplement, which is usually provided as kelp, but it's not an essential one. It really just depends on whether you have iodine in your diet. And then we already talked about the omega-3s. That's one where the science has not yet caught up with us. So stand by and we'll see. So those are the things I recommend. Now, I should perhaps also mention, if someone is thinking, well, how nutritious is this diet if you want to take B12 with it? Does that mean it's not a very nutritious diet? When you compare a plant-based diet to a diet that has meat in it, and you look at how nutritious they are, you add up the vitamin content of various kinds, and you look at the bad things like saturated fat and cholesterol, what you discover is that the plant-based diet is actually much more nutritious. Why would that be? Because meat doesn't have any vitamin C at all. Vegetables and fruits have a lot. Meat doesn't have any fiber at all. Plants have a lot. Meat doesn't have any complex carbohydrate at all. Plants have a lot. And when you look at the micronutrients that are in vegetables and in fruits and are very, very healthy for you, this abundance is missing in a diet that has a lot of meat and dairy products in it. So the reason I emphasize that is sometimes people say, well, will you get good nutrition on a vegan diet? The answer is you will get much better nutrition on a plant-based diet because vegetables and fruits and beans and whole grains are extremely nutritious, much better than compared to a plant-based diet, compared to a meaty diet. But you do want to look after your B12 and make sure you're not missing it.
All right, thank you so much. Dr. Rohan D. Silva, do you have any questions?
Yes, thank you, Ananda, for the opportunity. Dr. Neal, just a quick question. This is popping up in the chat, so I thought I'd share this for everybody's interest. Because we are in Sri Lanka, and one of the co-oils we use is coconut oil. And you did touch on the saturated fats when we were talking about, you included coconut oil. But now this is also another controversy in our country because we were used to, from our forefathers' time, we used coconut oil and they had great health. But after the palm oil regime came from Malaysia, coconut oil was thrown out and everything became palm oil, which is present day. There's a lot of, there's two schools. A lot of people are saying coconut oil is good, and you included that in the saturated fat category. So would you mind commenting, because we produce coconut and one of our co-oils is coconut oil. Thank you.
Right. Yes, I understand it's a traditional product. When we test it in a randomized clinical trial, what we do see is that coconut oil does cause a significant increase in LDL cholesterol or bad cholesterol levels. We see the same thing with palm oil. So that leaves the question as to, well, if people have included it and they've done all right, what's the basis for that? And that I really can't explain, because when we look at it in clinical trials, cholesterol levels do clearly and significantly rise.
Doctor, is it on a permanent basis or it's on a short-term basis? Because now we understand like CBD oil, right? I think it is derived from coconut oil. I'm not very sure whether is that the case, but what we sometimes we hear from different sources that the coconut oil is really good for the health as well. I don't know. Heard about anything like that?
Well, we have no basis for assuming that the effect is only short term. We have every basis for believing it's long term. So personally, I'm happy to use coconut oil, perhaps to shine my shoes or to polish my car, but I'm afraid to put it in my foods because of the hyperlipidemic effect.
So will you put coconut milk also? Because coconut milk is a staple in local cooking. Would you exclude that also?
Yes.
So
for the same reason, the fat in it is almost exclusively saturated fat.
Okay, so if so, what would you recommend as a guideline? Because we had to look at the economics of things. The oil you recommended would be very expensive here. So for a country like Sri Lanka, what would be the alternative? What oil should we go with?
You mean what cooking oil should a person use?
Yes. If coconut oil is not the way to go.
Well, keep in mind, you don't need any oil at all in cooking. I know this requires us to use different techniques, but for example, when you steam or boil or bake or roast something, you actually don't need oil at all. And these are the techniques that when people use them, they find that they do dramatically better. So let's say, for example, I'm starting a recipe and I'm going to cook some onions. I take a pan, it can be a steel pan, could be a non-stick pan if you had one, but just a regular stainless steel pan. And you heat it up very hot and you put the diced onions inside and stir them around and make sure it doesn't stick. And then you could put in, instead of oil, you can use a vegetable broth if you want to, about the same quantity as that you would use with oil, but it's broth. Stir it around and it cooks the onions wonderfully, and it's a lighter taste. And when people learn these kinds of techniques, what they discover is they can cook without oil. And when they do that, because oils have 9 calories in every gram, and it's all being removed, suddenly they discover they're losing weight really nicely and really easily, and their blood sugars are coming down. So our feeling is that when we make this kind of shift, it improves weight and also will improve diabetes and insulin resistance.
Thank you. Somebody's asking in the chat, so what about olive oil? Where are we in olive oil?
Okay, well, olive oil is the same in one case, in that it's still 9 calories per gram, compared to a carbohydrate, which is only 4 calories. Every oil has 9 calories in every gram. That's true for animal fat and vegetable oil, no matter what the type is. The reason that matters is it's the densest source of calories that you can find. Now, olive oil is a little different qualitatively because it's much lower in saturated fat. For coconut oil, it's almost entirely saturated fat. For olive oil, it's about 14% saturated fat. With olives, it's mostly monounsaturated, so it's not so bad for your cholesterol level. But keep in mind, how do you get olive oil? You take 10,000 olives and you bring them to the factory and you throw away all the fiber and all the pulp and you concentrate this oil and we put it in a bottle and we pretend that it's a natural product or even virgin. We use these nice words for it, but what it is a highly concentrated product that nature never had in mind at all for us. And so it's extremely concentrated in calories. So if a person is trying to lose weight and they go to olive oil, their cholesterol level may not be as high as it would be if they were using butter or ghee or other animal fats. That's good. But they're going to have issues with their weight because all oils have the same calories.
Thank you, Doctor.
Sure, thank you.
Doctor, how many minutes do you have for us, Doctor? How many more minutes?
Yes, I think we're fine till the bottom of the hour.
Okay, all right, thank you. I have another question, Doctor, regarding the same, keto diet. Now, actually, frankly, I have done a keto diet with plant-based keto diet. So is there any difference between plant-based keto and animal keto?
Some people have tried to do that, and they're certainly well-intentioned, and there are many reasons for doing that. It's people who follow the animal-based keto diet, they find like they're basically just the recipients of slaughter products. They're eating meat all day long, and it's kind of a disgusting diet for them. So people think, well, let me do it differently. And so what they'll do is they'll have avocado or other foods that happen to be high in fat and very low in carbohydrate. And if you're able to follow that, the likely effects would be that if you exclude all sources of carbohydrate from your diet, you may well lose some weight because carbohydrates are 50 or 60% or maybe more of what people would normally eat. And if that's all gone, you may lose some weight. But I guess I would ask the question why a person would want to do that, because we find similar weight loss or better with a completely plant-based diet that allows you to eat grains and beans and vegetables and fruits in their full variety. So I would suggest not avoiding them.
Okay, actually, I did a keto diet, and in fact, I lost some weight. But then I started, developing some other issues like, fatty liver and, AST, ALT level changed dramatically, and my cholesterol went up. I was a healthy person, but then immediately I stopped it. Even though you lose weight, actually, I think, it's really harmful, as you said earlier. Thank you, Doctor.
That's a terrific observation. Thank you for sharing that.
Yeah, yes. Any other questions, friends?
There's another question coming up from the chat relating to that. I'll place it this way. Within the question specifically, his doctor has told him that if you do intermittent fasting, eating oil is okay, but your advice we understood clearly, stay away from saturated fats, full stop. So taking that into account, would you like to comment a bit about intermittent fasting within a vegan diet?
Yes.
Or restricted eating? intermittent
Sure.
fasting and or time restricted eating. And this gentleman is trying to find out whether he can eat oil by doing intermittent fasting. If you would like to comment on that.
Okay, it sounds like someone is particularly eager to eat oil
Yeah, okay.
and trying to find ways to make it okay.
Yeah. So whether you are leaving that aside, would you like to comment on intermittent fasting and time restricted eating within the vegan dietary solutions?
Yes. Yeah, some people have done intermittent fasting in a variety of ways. A typical pattern is 5 days of normal eating and 2 days of reduced eating. And there's no reason not to do that. If you would like to do that, you may. Some people seem to enjoy it. The risk that we see, or the experience that many people have, is they start to anticipate the 2 days of not eating. And so it's Friday, and I know I'm going to eat less on Saturday and Sunday, so people inadvertently overeat on Friday, and then they eat too much on Monday. And so their intermittent fasting starts to not work so well. But on the other hand, I don't mean to put it down. If a person would like to try it and see how it works for them, there's no reason not to. It's perfectly okay. With regard to meal timing, there is a substantial literature now that shows that we were wrong back in the 1980s and 1990s when people were saying you should have multiple small meals all day long. Some people are doing just the opposite. They're having 2 big meals, one early in the morning and then one sort of early afternoon, and then not eating for the rest of the day. And some people find that they do really very well that way, and they don't get hungry, and their blood numbers get better. And I have no reason to discourage a person from trying to do that if they would like to. My suggestion, of course, is that for the meals that they do eat, that they be healthful plant-based meals. And if they would like to try meal timing, that could add to their benefit.
Thank you, Doctor.
Thank you, Doctor. We have another question from iPhone Sarat. You can please unmute, and if you want, you can keep the video on and speak.
Hi, my name is Sarat. I have a question on the sialic acid as well as a question on fructose. The question on the sialic acid is that by eating, I'm just trying to get your experience on this, that the human sialic acid versus animal sialic acid, that we have lost the ability to convert sialic acid 5AC to 5GC because we lost the enzyme when we mutated from our ancestor about 6 million years ago. Therefore, when we eat any kind of mammalian meat, in fact, all the red meat, and we have a tendency to have high cancer because we make antibodies against the animals who all have 5GC sialic acid. I am inquiring on your experience on the matter. Maybe that also eating red meat is a bad thing because of this antibody production, producing enormous amount of immune system abnormalities, getting immune reactions, as well as cancer risk. Second question is the fructose, connection with the fructose, evolutionarily that having direct connection to the fructose and our evolutionary point of view, fructose actually become the signal for metabolic syndrome because we developed a special, unique hibernation system when our ancestors were, before we discovered the fire, we were hibernating practically about 15 million years ago. And that hibernation technique of storing energy in the body, fat, lipid abnormalities, all that, to building enormous amount of fatty tissue was the only defense system. And the trigger, just like the bear who eat fructose by eating the fall or the winter fruit that was available at that time, the fructose coming from the fruit was the trigger for the bear to go hibernation. And currently, because we have enormously produced this high fructose cornstarch syrup, and that's triggering as if the winter is coming, but winter never come. But we develop metabolic syndrome on the fact that it is the same stimulant for our body to go into hibernation. Bear's hibernation and the lipid abnormality that you see in metabolic syndrome that ultimately produce NCD, non-communicable heart diseases, including heart disease, diabetes, coronary artery disease, including cancer and all that, may be due to the industrialization triggered food industry producing high fructose intake from cornstarch high fructose, because it is a direct trigger, because the fructose is the stimulant that trigger this system of tell the body to go into hibernation. I don't know whether you have any experience on that. I just want that two comments. One is the sialic acid versus the fructose. Thank you, but I really appreciate your speech,
Okay.
Dr.
Well,
Barnard.
first of all, thank you very much for your excellent questions and for paying attention. And I hope this 90-minute talk hasn't made anyone want to go into hibernation yet, but hopefully these have been useful. Regarding fructose, high fructose corn syrup, what they do is modify the corn syrup so that it's higher in fructose than it was before, but it ends up being effectively chemically about the same as sucrose, about 50-50 glucose and fructose. And over the long run, I personally haven't, even though it's clearly an industrial product, I can't say that we've really seen market health effects from it. But let me go back to your earlier question, which I think is fascinating, talking about the antigenic effects and the contribution to diseases. I think here we're really on a new frontier as well. And let me draw on the example of thyroid disease. The vast majority of hypothyroid cases, I'm talking about Hashimoto's thyroiditis, that are not related to iodine deficiency, are in fact related to an antibody response. And the same is true for Graves' disease, hyperthyroidism. And you think, well, what the heck is causing this antibody response? And it's some sort of antigen. So here in the United States, researchers looked in the Adventist Health Trial at which groups had the highest levels of hypothyroidism or hyperthyroidism. And as you might have guessed, it's people who are exposed to either dairy antigens or meat antigens. And the people who are at the lowest risk are people who are not exposed to those antigens. Now, I would offer that only as a preliminary observation, even though it's a real one. The piece that is missing is we haven't taken people who have hypothyroidism and transfer them to a diet that is free of these antigens to see if they get better. And the same is true with hyperthyroidism, but I think it's a study that should be done. But I think your question is a very wise one, because when we look at so many autoimmune diseases, the antigens that appear to be the triggers for it, whether you're talking about asthma, type 1 diabetes, multiple sclerosis, or thyroid diseases, and many, many others, the antigens that are in question are largely dietary. Probably not exclusively, because you can get antigens from other sources, including infective sources, but I think you're onto something very important. So let me stop at that point, and I just want to thank, well, I want to thank the organizers, of course, but I want to thank all of you for allowing me to share this time with you today.
Thank you so much.
Thank you so much, Doctor, and you have been wonderful. And as usual, thanks for accepting our invitation and coming and giving this wonderful lecture. And you enlightened us, and I think lots of us have clarified all our doubts. Thank you so much, and have a blessed day today.
Thank you, and you as well.
All right, the audience. We still have some time, and if you have any questions, we have a panel of doctors. We can answer questions in Sinhala if you want. Maybe we have a few more minutes left.
Can you kindly send me the video that you're recording?
Yeah, we are putting into the YouTube and you can check in the next few days. Yeah, we can do that. If you can put your telephone number or WhatsApp number, we can do that.
Thank you so much.
Thank you. Thanks for your question as well. It's really wonderful. And Vipula Rajapaksa, you have any comments or anything?
Yes, Mr. Mahankande. මට ඩොක්ටර්ස්ලාට තියෙන ප්‍රශ්නයක් යොමු කරන්න. මම මේ හැමදාම උදේට බ්ලඩ් චෙක් කරනවා. එක දවසක් ඇක්සිඩන්ටලි බ්ලඩ් චෙක් කරනකොට එක ඩ්‍රොප් එක මේ ඊට පස්සේ දෙවෙනි පාරත් මම චෙක් කරා. පළවෙනි සැරේ 100 ආවනම් දෙවෙනි සැරේ 120 වගේ ආවා. ඉතින් මට පුදුම හිතුණා මේ same blood dot එක within a second මෙච්චර වෙනසක් වෙන්නේ කොහොමද කියලා. ඒක පොඩ්ඩක් පුළුවන් ද explain කරන්න?
Dr. Harris, would you like to comment on that?
ඇත්තටම මම හිතන්නේ බ්ලඩ් ෂුගර් මීටර් එකේ ඔකේ සමහර වෙලාවට කැලිබ්‍රේෂන් එරර්ස් එන්න පුළුවන්. එකම එක ලොකු වෙනසක් එන්න අමාරුයි එකම බ්ලඩ් ඩ්‍රොප් එක නම්. එකම දේ එක්ස්පෝස් වුණාට පස්සේ කෙමිකල් බයෝකෙමිකල් චේන්ජස් නිසා සමහර විට වෙනසක් වෙන්න පුළුවන්. හොඳම දේ තමයි ඊට පස්සේ රෙගියුලර්ලිම කවුන්ට් එකක් තියාගත්තොත් අපිට අර වගේ ඩීවියේෂන් එකක් එනවනම් ඒ ඩීවියේෂන් එක කොච්චර රෙගියුලර්ලි එනවද කියන එක පොයින්ට් අවුට් කරලා you know the blood sugar meters හදන different companies තියෙනවනේ. ඒකට ඒ වගේ අයකට ඒක ඒ දැනුවත් වීම කරා නම් ඒගොල්ලෝ ඒක කැලිබ්‍රේෂන් එකේ මොනවා හරි ඉෂුව එකක් තියෙනවා නම් ඒක ගැන හොයලා බලලා මොනවා හරි කරාවි. ඒ නිසා මම හිතන්නේ better that you mention that ඒ වගේ ප්‍රශ්න අපිට හරියට එනවා especially blood pressure monitoring වල එනවා. blood pressure monitoring කරද්දිත් especially that monitor එකේ pressures අපි මැනුවල් කරන එක තමයි හොඳම. නමුත් මොනිටර්ස් වලදී ඒ වගේ කැලිබ්‍රේෂන් එරර්ස් එන්න පුළුවන්. ඒවා රෙගියුලර්ලි එනවා නම් ඒක මොනිටර් කරලා ඒක chart කරලා ඒ frequency එකත් එක්ක ඉන්ෆෝම් කරා නම් හොඳයි ඒ කම්පැනි එකට. then they will take some action.
Okay, thank you, Doctor. I think that has answered that question. Is that right, Vipula? You're muted. Please unmute.
දැන් මට ඒක ප්‍රශ්නයක් වුණා. මොකද මෙහි අර මේ අපිට ඕන තරම් ස්ට්‍රිප්ස් එහෙම ගන්න තියෙන හින්දා මම ඊට පස්සේ කරේ same blood dot එක හැමදාම දෙපාරක් චෙක් කළා. මම හිතුවා එකපාරක් 100 නම් අනිත් එක 120 නම් 110 වගේ ඇවරේජ් එකක් ගන්න පුළුවන් කියලා. ඒ අයිඩියා එක වැරදි නේද ડોක්ටර්?
ඒක නම් ගන්න අමාරුයි. හොඳම දේ තමයි අර ඒ විදියට දිගටම ඒක මොනිටර් කරලා chart එකක් මේන්ටේන් කරා නම් හොඳයි. එතකොට පළවෙනි එකද වැඩි දෙවෙනි එකද වැඩි කියන එක ගැනත් හොයන්න පුළුවන්. එතකොට අපේ මුල එකේ ඉඳලා දෙවෙනි එකට වෙනකොට බයෝකෙමිකල් චේන්ජස් අර එක්ස්පෝස් වුණාට පස්සේ රූම් එකට ඊට පස්සේ යම් යම් චේන්ජස් තියෙනවද නැද්ද හොයන්න පුළුවන්. හැම වෙලාවෙම දෙවෙනි එක නම් වැඩි එහෙම නැත්නම් පළවෙනි එක නම් වැඩි. ඒක ගැන අපිට තව ටිකක් සයන්ටිෆිකලිත් බලන්න පුළුවන්. ඒකේ මෙකැනිසම් එකක් ෆිසියොලොජිකල් පැත්ත බයෝකෙමිකල් පැත්ත. හරි ඒක සාම්පල් එක මොකද්ද කියන එකත් කලින් එකද දෙවෙනි එකද කියන එකයි how frequently එනවද කියන එකයි ඒ ටික ඔක්කොම මොනිටර් කරා නම් chart කරා නම් හොඳයි කියලා හිතනවා.
දැන් ડોක්ටර් මේ වෙලාවේ මම මේ ප්‍රශ්නේ අහන්නම්. මම සාමාන්‍ය බ්ලඩ් චෙක් කරනකොට Monday to Sunday කරනවා නම් දවස් 7 ඇඟිලි 7ම මම පාවිච්චි කරනවා දවසට එක ඇඟිල්ල ගානේ. මේ එහෙම කරන එකද හොඳ නැත්නම් ඒකේ කිසි ප්‍රශ්නයක් නැද්ද ඕන විදිහට කරාද?
ඔව් ඉතින් අර ට්‍රොමටයිස් වෙනවා එකක් දිගටම කරනකොට. ඉතින් මාරු කරන එක නම් හොඳයි. අපි වැක්සින් දෙනකොටත් මාරු කරනේ දෙන්නේ. එකම තැනට දෙන්නේ නැතුව. ඒක නිසා ඒකේ නම් ගැටලුවක් නැහැ.
හොඳයි. බොහොම ස්තුතියි ડોක්ටර්. Thank you very much. Appreciate it.
Welcome.
Okay, thank you so much. And we have another question. Dr. Namal Vijay Singh, or any comments? Please unmute and speak up. You're still muted, Doctor. Unmute when at the.
Hi, I'm sorry. Hi,
It's
good
okay.
evening.
Good
Hi.
evening. Right.
I'm Dr. Namal. I'm actually a sports medical doctor at Nigambo Hospital. I have a Facebook page on my own, which has around 100,000 followers there, and I have been like saying the same thing about the saturated fat as well as the red meat consumption. And there has been a lot of arguments going on with the people who have this keto, as you said, the very well mentioned, the methodology people about
Yeah.
red meat consumption. That's why I really wanted to know from them about the plant-based diet, as well as like at least the frequency of red meat consumption. I know that that has been like gone very viral in the Sri Lankan texture about like people eating red meat more and more, and they are claiming to be healthy and losing weight. And on the other hand, now we realize that this is the case. But I honestly want to know, like, I have been also posting certain things about red wine as well as like moderate consumption of alcohol. I know this may not be related to the topic. I'm extremely sorry but like, since this is a very well discussed question all the time by many people, now WHO recently said zero alcohol, and you know, there are no people who are on zero alcohol. They do consume alcohol, and I do think that there should be upper limit, at least like you said, 2 standard drinks or 1 standard drinks and so on. Can I please know from the panel? I know there are a lot of expert doctors here with a lot of experiences. At least, is there a like because like people get very well confused. Some cardiologists say that like, okay, you can have a little a sip or a day, blah blah blah, and like there's no clear demarcation. I know these are all controversial points all the time, but from the panel, is there a like a understanding about moderate alcohol consumption? Is it okay? Maybe the red wine thing, or else beer, like you can say 350 ml per day, and like not more than that, or 2 standard drinks, maybe wine 150 ml, or alcohol 90 ml, 80 period proofs, like so on. Like there is a moderate consumption standard, right? So just want to know from you all, like how can we, if a patient comes and asks, like since we are doctors, like they look up to us to give clear, straightforward answers rather than vague answers. So any idea on that?
Dr. Harris, you want to comment on that? Or
Sorry,
is Dr. Danayak around? Or Dr. Sujoy Wickramasinghe? I think they are in a remote container income, so don't know whether they are.
Okay.
Okay, Harris Patrige.
sorry, actually, I don't have any scientific evidence that the alcohol, even the small amount, which making you more healthier, but even other way also, I can't exactly tell no alcohol and all that. So still it is a controversial, as you said, but generally with our cultural and religious setup, we, even as doctors, we say better not to have alcohol. Actually, that's my policy. I don't know how others agree, but generally alcohol, when you start drinking, sometimes you will lose your control. Sometimes you will end up with, especially when we are dealing with the people, not the educated group, but even in educated, that problem will come. So better, in my opinion, no alcohol, and
Okay.
totally a plant-based diet. That's all.
Ananda, shall I contribute on that?
Yeah, please go ahead.
Dr. Namal, thank you for that question. 2 aspects on that. I think one of my first questions, if you were there, I asked about the gut microbiome.
Microbiome.
Gut microbiome is the most leading, as Dr. Neal Barnard identified, is the most upfront research forums which is coming up. Now, we have 10 to the power 14 of bacteria flora in it. And all these various things we eat will affect that. So alcohol is one of the most dangerous things for the good bacteria, because they will get completely compromised when you each time drink alcohol, because in simple context, alcohol is a toxin. So when you drink a toxin, that is why, now I'm a psychologist, I'm bringing that angle also. When you take a toxin, now caffeine has effect on it. It affects your nervous system, and your brain and your neurotransmitters are affected. I'm not going to go into the list because you're a doctor. Certain neurotransmitters get affected with caffeine. Caffeine is the most legal drug in the world. Okay. So we are trying to control cigarettes, but caffeine is the most legal drug. So caffeine itself has another story. So I just touched on caffeine. Caffeine has, coffee has a lot of good things, but caffeine has issues. Now, borrowing on that, when you go to alcohol, alcohol being a toxin, it affects your neurotransmitters, your nervous systems, and that is why, as Dr. Harris said, you get into a high state and you're out of control. So let's start there. So the effect on the brain is there's clear evidence. If you do share my your number and you want to talk to me further outside this, I'm happy to take this dialogue further with you. I can give you scientific evidence where there is established research. Even the smallest dose of alcohol will shrink your brain. To that extent, there is established research. Then also there is established research. When you take any form of alcohol, it messes up your gut microbiome. So alcohol simply as a toxin is not meant for the human body.
Okay, sir. Okay.
Okay. Yeah, go ahead, Doctor.
I'm sorry, like, can I just drop a WhatsApp, can I drop my message, a number in the chat too? Like,
Yes, do so. I'll take it up and I'll talk to you separately.
please, I do think that this area needs more clarification to the general public, and we do have a, what do you call, sort of like a portal way through the public, like we can actually like give all this information to the public, because which they deserve. Like, of course, like even the red meat part, again, like there has been a lot of controversial arguments in the general public about people following certain methods. So if at all possible, like if we can get this message across, because we recently followed one lifestyle medicine course in Sri Lanka that was also like mentioned the same thing about the plant-based diet and the legumes and so on. But like they generally mention this moderate alcohol consumption, the way forward about 1 standard drinks and 2 standard drinks and so on. But there's a teaching in that. So like if certain things can be clarified, I'll be really appreciated.
Yes, and thank you for your contribution on the red meat discussion. There's no controversy on that. Now, there is very clear list established by WHO on carcinogenic food types. Red meat is very clearly on that. It's a carcinogen. So that is very clearly established. So there are all these, as Ananda said, we don't want to tell the names. There are various groups talking about meat-based diets in Sri Lanka. And they have branded their own product, and so many ill-informed following is going on. So there are like various groups trying to pump up red meat, but red meat is in the top 10 of the carcinogen list, like asbestos. So are we going to eat asbestos? No. So it's in that same category.
True. Thank you so much for that. Thank you.
You're welcome.
Yeah, and also I would like to bring to your attention a website called nutritionfacts.org. This is a fantastic website by Dr. Michael Greger. Let me show you, actually. Let me share my screen. And this one, can you see my screen here? This screen, can you see, please?
Yes, Anand, we can see.
You can see that. Okay. This website, this is nutritionfacts.org. This is Dr. Michael Greger. He's another giant in this nutrition and wellness area. And you can ask any question here, like is alcohol good, for example? So you get maybe 5 minutes videos and 2 to 3 to 5 minutes videos, and he's always talking about complete research-based stuff. So and you might want to use this site also for any question. Actually, he has answered almost everything what we get. Nutritionfacts.org. So you might want to try that. And I'm not a doctor, but I have listened to all these big, world-class doctors about wellness, and no one is recommending alcohol or any meat, red meat, basically. So that's just a little bit of.
Ananda, there's a Sumudhu Priyanka saying, sir, then Sinhaleng kata karanna puluwanda, sir. I don't know what is required, whether to explain all this in Sinhala or they have a question. If you look at the chat.
Yeah, Sinhaleng puluwang. Mama may. Before that, let me go to P. Puranjan. There's a person raising the hand. One gentleman, I think. So please unmute and speak up. Then we'll get back to that, Rohan.
Hello, everyone. Thank you so much for the wonderful presentation on health awareness. I would like to know, is there any special diet for high TD triglyceride cholesterol level patients?
I don't know. question correctly. Can you please repeat?
TG. Is there any special diet for TG who has a TG cholesterol level, triglyceride cholesterol level?
Dr. Rohan, you have something to say about it? I'm not very sure actually.
Your Punarjan, you're asking your triglyceride cholesterol level
Yeah,
is
exactly.
elevated.
Yeah.
Yeah. So you're asking how to control the elevated level to and normalize it.
Yeah, exactly.
Yeah. So you're very lucky you came at the right day and listened to one of the world's greatest experts on the
so
diet
much.
which is required. So if you do adapt a vegan diet, as Dr. Neal Barnard explained, he went to the molecule cellular level and explained how the glucose gets into and how the complications arises. This video will be available. You can look at it up again. And if you listen to it very carefully, it was scientifically explained how we develop all these NCDs, non-communicable diseases, which is triglyceride. So, so if you do his regime is a low fat or no fat diet, that is where he went. So if you do adapt that, then your triglycerides are going to get normalized. And on top of it, I must say you must exercise. I don't know whether you exercise or not. We are not meant to sit in chairs and wait forever. We are a very primitive human species. So we have to exercise. So depending on your age and your background, you'll have to do the required exercises. Even simplest thing as walking. There is proven research. Just walking can make a significant change in your TGL levels. So if you combine a proper vegan diet and exercise, it's a matter of time before all that becomes normalized.
All right. Thank you, Doctor. I hope that question has been answered. Puranjan, yeah, Singling hand.
Yeah, thank you so much, Doctor, for the wonderful suggestion. Yeah, I'll try my best.
You're
And
welcome.
thank you, Asoka, Anand Mahinkanda, for arranging this event. Thank you all.
So much for actually asking that question. ස්වාමීන් වහන්සේ පාගොඩ ජනිත වංශ ස්වාමීන් වහන්සේට මට අතුස්සලා තියෙනවා. අන්මියුට් කරලා කතා කරන්න ස්වාමීන් වහන්සේ.
හැමදෙනාටම තෙරුවන් සරණයි බොහොම ස්තුතියි මේ වගේ වැදගත් වැඩසටහනක් සූදානම් කළාට අපි පොදුවේ දකින ප්‍රශ්නයක් තමයි මිනිස්සු අතර මතයක් තියෙනවා මේ සත්ව ආහාර නොගත්තොත් ඒක මිනිස්සෙකුගේ පැවැත්මට අහිතකරයි ඒක මේ මිනිස්යන්ගේ පැවැත්මට සත්ව ආහාර අත්‍යවශ්‍යයි කියන මතයක්. මේක පෞද්ගලිකව මම විශ්වාස කරනවා වෛද්‍ය ශාස්ත්‍රයත් ඒ වගේම වාණිජ්‍ය ශාස්ත්‍රයත් මේ දෙකොල්ල එකතු වෙලා කරන මේ යම්කිසි ගනුදෙනුවක් කියන එක පෞද්ගලිකව මට තියෙන ප්‍රශ්නය තමයි මේ සම්බන්ධව මානවයා පරිණාමණය වුණේ වානරයාගෙන් යයි පිළිගන්නා ලෝකය වානරයාට මස් මාංශ නැතුව ජීවත් වෙද්දී මානවයාට බෑ කියන්නේ හිතුවමුද?
ඔව් ඒක හරි. මම ඒකට පොඩි උත්තරයක් දෙන්නද? ඇත්තටම මේ අපේ ওই බොඩි ස්ට්‍රක්චර් එක අපි ගත්තොත් අපේ මේ ශරීර ව්‍යුහය අපි ගත්තොත් අපි කිසිසේත්ම මස් මාළු කෑමකට හැදිච්ච කෙනෙක් නෙමෙයි. මම ඕන පොඩි කරුණු ටිකක් මම හිතන්නේ මම අර ගියසරේ ලෙක්චර් එකේ කතා කරා වෙන්න ඇති මේ දැන් අපේ ශරීරය ගත්තොත් උදාහරණයකට අපි දත් ගත්තොත් අපේ ඉස්සරහෙන් දත් තියෙන්නේ පැතලි දත් මේ පැතලි දත් ඇතුලෙන් තියෙන අඹරන දත්. එතකොට අපි ඉස්සරහෙන් කඩාගෙන ඇතුලෙන් හපලා අඹරලා තමයි ගිලින්නේ. මේ ආහාර වෙනත් මස් නොකන සතුන්ගේ වගේ මම මේ කම්පයර් කරන්නේ ඔක්කොම මස් නොකන සතුන් සහ මස් කන සතුන් අතර වෙනස. දැන් එතන නමුත් මස් කන සතුන්ගේ තියෙන්නේ උල් දත් කීපයක් තියෙන්නේ හරිම ස්ට්‍රෝං මේ තද දත් තියෙනවා. සත්‍යක මරා ගැනීමට හැකි වෙන විදිහට. සහ ඒගොල්ලන්ගේ නියපොතුත් එහෙමයි. අපේ නියපොතු තියෙන්නේ බොහොම මේ ඇඟිල්ල රැක ගන්න විතරයි. නමුත් මස් කන සතුන්ගේ නියපොතු තියෙන සතුන්ගේ හරිම දැඩි උල් සහිතයි ශක්තිමත්. එතකොට දැන් අපේ හකු අපට උස්පාත් කරන්නත් පුළුවන් හරහට මෙහෙවන්නත් පුළුවන්. නමුත් මස් කන සතුන් සාමාන්‍යයෙන් බල්ලන්ට කොටියන්ට ඒ සතුන්ට උස්පාත් කරන්න විතරයි පුළුවන්. හකු හරහට මෙහෙවන්න බෑ. ඒගොල්ලෝ කරන්නේ මස් ටික සතාව මරාගත්තා ඉරාගත්තා ගිලිනවා. අනිත් එක ඒගොල්ලන්ගේ ආහාර දිරවීම සිද්ධ වෙන්නේ ආමාශය ඇතුලේ. නමුත් අපේ ආහාරය කියන්නේ මස් නොකන සතුන්ගේ ආහාර කටේ විදිහම සිද්ධ වෙනවා මේ ආහාර ජීර්ණය. ඒ කියන්නේ අපේ කෙලවල එන්සයිම තියෙනවා. එතකොට අනිත් එක අපි වතුර බොන්නේ වතුර උරලා. එතකොට සත්තු වතුර බොන්නේ මස් කන සතුන් වතුර බොන්නේ දිව එළියට දාලා. මතක් කරගන්න කොටියෙක් සිංහෙක් වතුර බොන ආකාරය බල්ලෙක් පූසෙක්. එතකොට අපි හැම වෙලාවෙම මස් නොකන අනිත් සතුන් වගේ වතුර උරලා තමයි බොන්නේ. අපි දිය දොතක් ගත්තොත් වතුර උරනවා. එතකොට ඒක තව විශාල වෙනසක්. අනිත් එක අපේ මේ GI tract එකේ නැත්නම් අපේ මේ ආහාර ජීර්ණ පද්ධතිය දිග ප්‍රමාණය සාමාන්‍යයෙන් අපේ ආහාර ජීර්ණය පද්ධතිය අපේ මනුෂ්‍යයාගේ ශරීරය වගේ නැත්නම් සතාගේ ශරීරය වගේ 6 ගුණයක් විතර දිගයි. මස් කන සතුන්ගේ දෙන්නේ ඒ ශරීර ප්‍රමාණය වගේ එකමාරක් වගේ. මොකද අර මස් කියන එක ආමාශයේ මේ බඩවැල් වල තියෙන්න බෑ. ඒක ඉක්මනට එළියට යන්න ඕනේ. මේ ඉතින් එතකොට එහෙමත් අපිට බලන්න පුළුවන්. අනිත් එක තමයි විශේෂම දෙයක් තමයි දැන් මස් කන සතුන්ට ඇත්තටම මේ ගොඩාක් කල් ආහාර නැතුව ඉන්න පුළුවන්. ආහාර නැතුව ඉන්න සමහර සතුන්ට දවස් ගණන් මාස ගණන් සති ගණන් මාස ගණන් ඉන්නත් පුළුවන්. දැන් කිමුලන්ට එහෙම මාස 6ක් විතර ඉන්න පුළුවන් ආහාර නැතුව කියලා කියනවා. නමුත් අපට මස් නොකන සතුන් නිතර ආහාර ගන්නට අවශ්‍යයි. අපි දවසට 3-4 සැරයක් කරනවා. අනිත් ඔය හරක් ගෝණු වගේ සතුනුත් හැම වෙලාවෙම කනවා. තව එකක් තමයි මේ ඇත්තටම විශේෂම දෙයක් අපි පැහැදිලිවම දන්න දෙයක් තමයි ඕනම මස් කන සතෙක් තමන්ගේ ඇඟේ හයියෙන් කියන්නේ තමන්ට ශක්තිය තියෙනවා සතෙක්ව තනියම මරාගෙන ගිලින්න. ඒකට දඬු මොගුරු කැටි පොළු තුවක්කු අරවම මොනක්වත් ඕනේ නැහැ. නමුත් අපිට කිසිම සතෙක්ව එහෙම මරා ගන්න බෑ. ඕනනම් කුඹියක් මරා ගන්න පුළුවන් වෙයි. අපේ හැකියාවෙන් අපට අඩුවානේ මේ මීමින් එක හාවෙක් එක්ලව දුවලා අල්ලගන්න බෑ. එතකොට අනිත් එක අපි හැම වෙලාවෙම කන්නේ දැන් මස් කන මිනිස්සු මේ කන්නේ දැන් ඔහු උයලා බැදලා තෙල් දාලා මොනවා හරි කරලා. නමුත් මස් කන සතුන් කන්නේ අමුයි. මරාගත්ත කාලා දෙනවා. ඉතින් අනිත් එක දැන් අපි හරි වාසනාවන්තයි. අපි මොකද දන්නේ මේ මස් කක අදුවන්නේ දැන් මස් කන සතෙකුට හැම වෙලාවෙම සතෙක් පස්සේ හඹා යන්න ඕනේ. සතෙක් පස්සේ දුවන්න ඕනේ. නමුත් අපි එහෙම නැහැ. මස් නොකන සතුන් හැම වෙලාවෙම ඒ ආහාරය එතන තියෙනවා. දැන් අපි අඹ ගහක් ගාවට යනකොට අඹ ගහ දුවන්නේ නැහැ. හරක් තනකොළ කන්න යනකොට තනකොළ දුවන්නේත් නැහැ. ඒ විතරක් නෙමෙයි මේ ආහාර නැවත ඒක ජනනය වීම සිද්ධ වෙනවා. දැන් අපි අඹ ගිරියකින් අඹ ගහකින් අඹ කඩාගත්තොත් නැවත අඹ හැදෙනවා. නැවත හැදෙනවා. අපි පලා කැපුවොත් නැවත ඒව දළු දානවා ලීලනවා. ඉතින් එහෙම ගතියක් තියෙනවා. නමුත් මස් කන සතුන්ට එක සතෙක් මරාගත්තා නම් ඉතින් එහාට නැවත වරක් ඒ සතුන්ගේ ඇතිවීමක් හටගන්නේ නැහැ ඒ සතාගේ. ඉතින් ඒ වගේ ඊටාත්ම පැහැදිලිව අපේ ශරීරය හැදිලා තියෙන්නේ මස් කන සතෙකුගේ ශරීරයක් හැටියට නෙමෙයි. ඉතින් අර ඔබ වහන්සේ සඳහන් කරා අපි මුලින්ම දැන් ඔය ආදම් සායව ගත්තත් ඒගොල්ලෝ කෑවෙත් ඇපල්. ඊට පස්සේ බෞද්ධ ආගමේ හැටියට අපි බ්‍රහ්ම ලෝකෙන් ආබසර බ්‍රහ්ම ලෝකෙන් ඇවිල්ලා පොළවේ රසූරා බීලා ඇල්ලහල් තමයි කාලා තියෙන්නේ. එතකොට චාර්ල්ස් ඩාර්වින් කියන හැටියටත් අපි වඳුරාගෙන් නම් පරිවර්තනය වුණේ. ඉතින් ඒගොල්ලෝ කාලා තින්නේ මේ ශාක. ඉතින් මේක මේ සම්පූර්ණ බොරු කතාවක්. අපිට මස්මාළු අවශ්‍යයි කියන එක. වහන්සේට ඒක උත්තරේ ලැබුණත් දන්නේ නැහැ. අනිත් එක ඒව කණ එක අපි හරියට මම නම් කියන්නේ අපි මේ ඩීසල් වාහනයකට පෙට්‍රල් දානවා වගේ වැඩක් කියලා. මේ පොඩි කාලේ දුවයි නමුත් ජග්ජග් ගාලා ඉඳලා ඒක මේ එන්ජින් මෑන් හිටිනවා. විශේෂයෙන්ම මේ කාලේ අපි ඒ කාලේ නම් මොනවා හරි වැරදි දෙයක් ගත්තා වුණත් අපි එලිමහනේ වැඩ කරා. ඒක නිසා මේ අපිට ඒව දිරවා ගන්න යම්කිසි හැකියාවක් තියෙන නැති. නමුත් වර්තමාන කාලේ ඒ හැකියාවක් නැහැ. ඒක නිසා මේ අපි සම්පූර්ණයෙන්ම ශාකමය ආහාරයකට යොමු වෙන්න ඕන කියන එක තමයි දැන් මේ බටහිර වෛද්‍යවරු කිය ඉන්නේ. ඔබ වහන්සේ ඒක අන්මියුට් කරලා කතා කරන්න. ඒ ගැන පැහැදිලි.
ඔව්. ඊටම පැහැදිලි. මම හිතන්නේ ඒකේ මම යම් විශේෂ කරුණු කීපයකුත් අද කියන්නේ අපි මේ දක්වා මේ ප්‍රශ්නය ගැන දිගටම අපි කතා කරනවා. අපි ওই මතය තුලත් ඍජුවම ඉන්නවා. නමුත් මේ වර්තමානයේ අපේ තියෙන අධ්‍යාපන ක්‍රමයේ වරදක් නිසාද මේ කියන ඇත්ත தත්ත්වයේ ඉදිරිදරව් කරන අධ්‍යාපනයේ පමණක් නෙමෙයි මම හිතන්නේ ඒක වාණිජ පැත්තයි ඔක්කොම දැන් අපිට පහුගිය කාලේ අහුණානේ මේ ශරීරයට අහිතකර ඖෂධ ගෙන්නලා ලොකු ප්‍රශ්නයක් ගෙන්නලා හරි මේ රටේ නිෂ්පාදනය කළ රහසිගතව. ඒතර එවැනි අමානුෂික ක්‍රියාදාමයන් තියෙන රටක අපිට බලාපොරොත්තු වෙන්න බෑ. හොඳ පෝෂ්‍යදායී ආහාර වේලක් මේ පහසුවෙන් හොයාගන්න පුළුවන් එකක් තියෙනවා. ඒක කරුණාකරලා ගන්න කියලා කියලා දෙයි කියලා හිතන්න බෑ. නමුත් මෙවැනි වැඩසටහන් මම ඉල්ලා හිටිනවා අපිට මේක සිංහලට පරිවර්තනය කරලා හරි නැත්නම් අර සබ්ටයිටල් දාලා හරි කමන්නේ මේක වැඩි ජනතාවක් අතරට ගෙනියන්න පුළුවන් විදිහට මේ වීඩියෝ එක සකස් කරලා දෙන්න කියලා මම ඉල්ලීමක් කරනවා. මම ඒක දහම් පාසල් සහ පාසල් හා ඒ වගේ පිරිස් අතරට මේක යවන්න මොකක් හරි වැඩ පිළිවෙලක් හදන්නම් ඒක.
හොඳයි. බොහොම පින් ස්වාමීන් වහන්සේ අපි ඒක ගැන කලකලා බලමු. තේරුම් ගන්නයි. පුරංජන් මහත්තයාට තව ප්‍රශ්නයක් තියෙනවද? තියෙනවා නම් අන්මියුට් කරලා කතා කරන්න.
බොහොම ස්තුතියි ආනන්ද මහත්තයා. නෑ වැඩි ප්‍රශ්න තිබුණේ නැහැ. බොහොම ස්තුතියි. ගොඩක් දේවල් අපි ඉගෙන ගත්තා ඔබතුමාගේ සහ ඒ විස්තර මහත්වරුන්ගේ.
හරි. හොඳයි. හොඳයි එහෙනම් අපි දැන් පැය දෙකක් විතර ගත කරලා තියෙනවා. මම හිතන්නේ වෙන ප්‍රශ්නත් නැහැ වගේ. අපි එහෙනම් මෙතනින් අපේ සාකච්ඡාව අද අවසන් කරමු. අපි මේ අවස්ථාවේදී ඉතාමත්ම ස්තුතිවන්ත වෙනවා. මේ සහභාගී වෙච්ච හැම දෙනාටමත් ඒ panel of doctors සහ Dr. වෛද්‍ය නීල් බර්නාඩ් මැතිතුමාට. දැන් මේ ඇමරිකාවේ විශාල වශයෙන් සිද්ධ වෙන දෙයක් තමයි මේ vegan concept එක නැත්නම් මේ whole food plant based කියන එක. කියන්නේ දැන් vegan වුණත් අපිට දැන් Coca-Cola වගේ දෙයක් පැණි බීම එහෙමත් තියෙනවා vegan ඒවා සත්ත්ව නෙමෙයි. නමුත් ඒවත් හොඳ නැහැ. මේ whole foods කියන්නේ අපි සාමාන්‍යයෙන් අපේ ගමේ ගොඩේ එළවලු පළතුරු ගෙඩි පිටින් කන්න පුළුවන් නම් තමයි වඩාම හොඳ. ඒ ගැන අපි දැනුවත් වෙමු. අපේ ඒක මේ ඇත්තටම පරිසර හිතකාමී, සත්ව හිතකාමී, අපේ මනස පැහැදිලි වෙනවා, පිරිසිදු වෙනවා. අපි දන්නවා අපි සත්‍යක මරාගෙන වේදනාවක් දීලා කන්නේ නැහැ කියලා. ඉතින් අපිට මෙච්චර විශේෂයෙන්ම ලංකාවේ මේ තරම් කන්න දේවල් තියෙද්දි මෙච්චර හොඳ පරිසරයක් තියෙද්දි ආහාර වර්ග තියෙද්දි දහස් ගාණක් අපි මේ සත්‍යක මරාගෙන කන කෑම නිසා ලෙඩ වෙලා තමයි මැරලා යන්නේ. මම මුලින් කිව්වත් දන්නේ ලංකාවේ මැරෙන මේ මරණ අනුපාත වලින් 85%ක්ම මේ non communicable diseases එහෙම නැත්නම් බෝනවන රෝග වලින්. ඉතින් අප පැහැදිලිවම වළක්වා ගන්න පුළුවන් අපේ ආහාරය වෙනස් කරලා plant based diet එකකට. තව මොනිකා කියලා මහත්මියක් අත උස්සලා තිනවා. ඒ ප්‍රශ්නෙට ඉදිරි දීලා ඒක අවසාන ප්‍රශ්නේ හැටියට ගමු. ඔබතුමිය එහෙමනම් අන්මියුට් කරලා කතා කරන්න.
ඔව් ડોක්ටර් ගොඩක් මතයක් තියෙනවා මේ vegetarian iron deficiency වෙනවා කියන එක. ඒ සම්බන්ධයෙන් අදහසක් තියෙනවා නම්?
නෑ ඇත්තටම මෙහෙම දෙයක් නැහැ. ඉතින් මෙහෙමයි. මම නම් අහලා නැහැ එහෙම දෙයක්. නමුත් ඉතින් iron tablets කියන එක හරියම cheap දෙයක්. අපිට ඕන නම් බොහොම මේ මිල අඩු දෙයක් වහමුසින් අරගෙන supplement එක ගන්න සැකයක් තියෙනවා නම් ඔකට කියන්නේ හේතුව තමයි හරක් මසල iron තියෙනවා ටිකක්. හරක් මසල යකඩ තියෙනවා. නමුත් අපි ඇත්තටම ලවණ වර්ග මේ khනිජ ලවණ ඔක්කොම ලැබෙන්නේ ශාක වලින්. ඉතින් ඒක ගැන කිසිම කතාවක් නැහැ. අපි ගන්නවා නම් ගොටුගොල්ල මුකුණු වැන්න කතුරු මුරුංග ඔය ආදි වශයෙන් සාමාන්‍යයෙන් අපේ ගමේ ගොඩේ තියෙන පළතුරු එළවලු කනවා නම් ඒක එහෙම ප්‍රශ්නයක් වෙන්න කිසිම හේතුවක් නැහැ කියලා තමයි කියන්නේ.
විටමින් B12
නෑ විටමින් B12 ඇත්තටම දැන් විටමින් B12 නිතර එන ප්‍රශ්නයක් අර වෛද්‍යතුමාත් කිව්වා අපේ ඩොක්ටර් නීල් බර්නාඩ් ඒක සප්ලිමන්ට් එක ගන්න කියලා කොහොකට හොඳයි කියලා. දැන් ලෝකේ හැම කෙනාටම කියන්නේ මස් කෑවත් මස් නොකෑවත් විටමින් B12 ගන්න කියලා කියනවා. ඇත්තටම ওই විටමින් B12 එක තියෙන ඕකේ තියෙන සම්බන්ධය මේකයි. මම දන්න තරමින් විටමින් B12 කියලා කියන්නේ මේ පස්වල තියෙන බැක්ටීරියා එකක්. පස්වල තමයි ඒක තියෙන්නේ. එතකොට මස් කන සතුන් ඒ කියන්නේ හුඟක් වෙලාවට ඔය මේ උලා කන සතුන් හරක් බැටළුවෝ වගේ කුකුල්ලෝ ඒගොල්ලන්ට මේ විටමින් B12 එක ඒගොල්ලන්ගේ ඇඟට යනවා පස් වලින් අර ආහාර නිසා. දැන් ඒක නිසා තමයි විටමින් B12 සත්ව ආහාර වල තියෙන්නේ. නැතුව ඒ සතාගේ ඇඟේ හදන දෙයක් නෙමෙයි විටමින් B12 කියන්නේ. දැන් අපිට ඉස්සර ওই ප්‍රශ්නේ ඇත්තටම තිබුණේ නැහැ. මොකද අපි ඉස්සර ගමේ ගොඩේ ඇලෙන් දොලෙන් වතුර බිව්වා. එතකොට බිම වැටෙන පළතුරු කෑවා. නමුත් දැන් එහෙම නෙමෙයි. අපි පලා වර්ග වුණත් දැන් කොටකොල එහෙම කන්නකොට ඒවැ තියෙනවා B12. ඒක තියෙන්නේ කොලේ පිටපැත්ත තමයි තියෙන්නේ අර පස් වලින් එන දේ. නමුත් දැන් ඉතින් ඒක අඩු වෙනවා මොකද අපි ඔය රසායන වර්ග නිසා ඒක ගොඩක් හොඳට හොදලා කරනවා. ඉතින් ඒකට අර B12 ටිකවත් වෙනවා. ඉතින් ඒ වගේ දේවල් වෙන්න පුළුවන් නිසා කොහොමකටත් හොඳයි විටමින් B12 සප්ලිමන්ට් එකක් ගන්නවා කවුරුත් මස් කෑවත් නොකෑවත්.
ඔව් මිස්ටර්.
අපි එහෙනම් මෙතනින් අවසන් කරමු. මම හිතන්නේ තව ප්‍රශ්නයක් තියෙනවා. හොඳයි ඒකට ඉඩ දෙමු. Galaxy MO2 කියන මහත්මයා වෙන්න ඕනේ. අන්මියුට් කරලා කතා කරන්න.
ડોක්ටර් එතුමා මේ කියපු එක ඇහුන්නේ නැහැ සිග්නල් පේඩි එකක් හින්දා ඉන්ටර්මිටන්ට් ෆාස්ටිං ගැන පොඩි පැහැදිලි කිරීමක් කියන්න පුළුවන්ද?
ડોક્ટર රෝහන් ඒ ගැන කතා කරන්න පුළුවන්ද?
Yeah, sure. Ananda, thank you. ඔබතුමියට මේ ප්‍රශ්න ඉදිරිපත් කරාට intermittent fasting කියන්නේ මේ යම්කිසි කාල පරිච්ඡේදයකට සීමා කරගන්නවා අපි ගන්න ආහාර ප්‍රමාණය. ඊට පස්සේ කාල පරිච්ඡේදයක් තුළ අපි ආහාර නොගෙන ඉන්නවා. එතකොට දැන් උදාහරණයක් වශයෙන් දැන් සාමාන්‍යයෙන් ඉන්ටර්මිටන්ට් සාමාන්‍යයෙන් දාන්න අපි ගන්නේ පැය 24 කාල සීමාවක පැය 16ක් නිරාහාර පැය 8ක් ආහාරයට යොදා ගන්නවා. ඊටු පැය 16 නිරාහාරව ඉන්නවා. ආහාර ගන්නේ නැතුව. එතකොට පැය 8 කාලය තුලදී තමයි අවශ්‍ය ප්‍රමාණයට ගන්නවා. එතකොට මේ ඒක තමයි ඉන්ටර්මිටන්ට් ෆාස්ටිං කියන්නේ. අර ඉන්ටර්මිටන්ට් කියන්නේ කඩ කරන හින්දා එතනදී සිදු වෙන්නේ ඇගේ ක්‍රියාවලියේදී විද්‍යානුකූල ක්‍රියාවලියේදී මොකද අපිට ආහාර පද්ධතිය ගත්ත ආහාර ටික ජීර්ණය කරන්න වෙලාවක් අවශ්‍යයි. ડોક્ટર නීල් බර්නාඩ් කිව්වා දැන් අපි නිතරම කෑම ගන්න ගියාම තව ගොඩක් ප්‍රශ්න ඇති වෙනවා. ඔය ඉන්සුලින් රෙසිස්ටන්ස් ඩයබටිස් වලට ප්‍රධානම කාරණය තමයි අපි ආහාර වේල් තුනෙන් අමතරව ආහාර ගන්නවා. ඉස්සෙල්ලම ආහාර වේල් 3කට අඩු කළා තේ බොන වෙලාවල් නතර කළා ඉන්න ඕනේ පළවෙනි කාරණය. ඊන් එහාට යන පුද්ගලයෙක් උදේ ආහාරය දවල් ආහාරය අරගෙන ඕනේ නම් ඒ පැය 8 ඉවර වෙන්නේ උදේ 8ට පටන් ගත්තා නම් රෑ 8. එතන ඉවර වෙන තැනදී ඒක නතර කරන්න ඕනේ. ඊට පස්සේ රෑ වෙලාව තියෙන්නේ රෑට අපි නිදිනේ කන්නේ නැහැනේ. එතනදී අපේ ආහාර ජීර්ණ පද්ධතිය ඒක අවශ්‍ය ඉවර කරන්න ඕනේ. තව එක හේතුවක් විද්‍යානුකූල අපි කන හැම සැරේම අපේ මේ බඩවැල 10%ක් ඩැමේජ් වෙනවා. එතකොට ඒක තමයි දැන් 4 සැරයක් යවන 140 ඩැමේජ් වෙලානේ. ඒක විසඳෙන්න වෙලාවක් තියෙන්න ඕනේ. ඉතින් දැන් අපේ ලංකාව බොහොම ක්‍රියාශීලී වෙලා රාත්‍රී කාලේ 10ටත් පස්සෙත් කනවා. එතකොට ඒක යථා තත්ත්වයටපත් වෙන්න විදියක් නැහැ. ඒක තමයි ඉස්සෙල්ලා ඉන්ටර්මිටන්ට් ෆාස්ටිං කියන්නේ. ටයිම් රෙස්ට්‍රික්ටඩ් ඊටින් කියන්නේ යම්කිසි කාල සීමාවකට දීලා කන එක. මොකද අපි සූර්යයත් එක්ක වැඩ කරන જાතියක්. අපි උදේට නැගිටින්න ඕනේ, රැට නිදා ගන්න ඕනේ. දැන් රැට ලයිට් බල්බ් දාගෙන අපි හිටියට ඒක අපේ ඇඟ තාම ඒකට හැදිලා නැහැ. එතකොට ඒ ක්‍රමයේදී නම් කියන්නේ ඉර අවරට එනකොට කන්න පටන් ගන්නවා. ඉර උදෑසනදී කන්න පටන් ගන්න ඕනේ. ඉර අවරට යනකොට කන්න නවත්තන්න ඕනේ. ඉතින් ওই දෙකම එකතු කරාම සංකලනය හොඳම දේ තමයි ඉර එනකොට උදේ 7ට තම දාගන්න 6 හෝ 6 සිට 6ට 7 සිට 7ට ඒ කාලය තුලදී කාලා නවත්තන්න ඕනේ. ඒක තමයි සරලම දේ. ඉන්ටර්මිටන්ට් ෆාස්ටිං නම් ඒ කාල සීමාව තව පොඩ්ඩක් අඩු කරන්න පුළුවන් පැය 8ක් දක්වා. පැහැදිලි කියලා හිතනවා. ප්‍රශ්නේ යොමු කරපු මොකද තව තියෙනවා?
ඔව් ඊටමත් පැහැදිලි එක මේ දැන් සමහරක් කට්ටිය තව කියන දේ තමයි අපි මොනවද කන්නේ මස් කන්නේ නැතුව එහෙම කියලා. දැන් මම නම් හුඟක් වෙලාට කරන දෙයක් තමයි ඔය අපිට ඔය දැන් වැඩකට යන කෙනෙක් වුණත් ඈත ගමනක් යන කෙනෙක් වුණත් මොනවද ඒ තමයි එක්ක කැරට් ටිකක් එහෙම නැත්නම් තඹපු කඩල ටිකක් තඹපු මේ කවුපි ටිකක් මුං ඇට ටිකක් ඒවා උයන්නත් ඕනේ නැහැ. නිකම්ම පොඩි කන්ටේනර් එකට දාගෙන ගියාම තමන්ගේ ගමන් මල්ලේ බස් එක නවත්තන තැනකදී හරිය නැත්නම් අවශ්‍ය කියන්නේ බඩගිනින වෙලාවෙදී මේක හපන්න පුළුවන්. අපිට මේ ඉතාමත්ම ලේසි අනිත් එක ඒවා ෆයිබර් තියෙනවා, පිස්ටේ තියෙනවා, වෙනත් khනිජ වර්ග තියෙනවා, ලවණ තියෙනවා. ඉතින් එහෙම කෑමකට අපි පොඩක් හුරු වෙනවා නම් මේ බත්ම හොය මේ බත් කඩවල් ගානෙම යන්නේ නැතුව ඉතින් බත් කෑවට කිසිම වරදක් නැහැ. ඒකත් ප්‍රමාණයකට මේ ඉතින් අපිට මේ අපේ මේ ආහාර වේල හදාගත්තා නම් ඇත්තටම අපිට සුඛිත මුදිත ජාතියක් වෙන්නට පුළුවන් ඉදිරියට. අපේ උත්සාහයත් ඇත්තටම මේ අපේ රටේ ජනතාවට මේ දැනුම නැති නිසා ගොඩක් මේ බටහිර රටවල් වලින් ඒ දැනුම අරගෙන මොකද මේ රටවල් දැන් මේ ප්ලාන් බේස්ඩ් ඩයට් එකට යනකොට අපි තිබිච්ච ප්ලාන් බේස්ඩ් ඩයට් එක නැති කරගෙන අපි මේ මස් කෑමකට ගිහිල්ලා දැන් ඇත්තටම නැති වෙන જાතිය බවට පත් වෙලා තියෙනවා. ඉතින් හොඳයි මම හිතන්නේ අපේ අද කාලය දැන් ගොඩක් ඉක්ම ගිහිල්ලා තියෙන්නේ. හැමදෙනාටම එහෙනම් අපි මේ අවස්ථාවේදී ස්තුති කරනවා විශේෂයෙන්ම ડોક્ટર රෝහන් ડોક્ટર හැරිස් පතිරගේ ડોક્ટર කුමුද දහනායක මම හිතන්නේ ඒගොල්ලන්ට සම්බන්ධ වෙන්න බැරි වුණා. අපි එහෙනම් මෙතනින් මේ කතාව අද අවසන් කරන හැමදෙනාටම සුබ දවසක්.